All right, we're back in live on YouTube. Let's see if people come back in, and we'll test it. All right, now Facebook, please understand that your comments scroll really quickly, and I miss them. And so please ask it again and be the squeaky wheel. Keep asking it over and over and over again. You could use capital letters if you want to get my attention. Laura says, if something in diet is causing irritation in the bladder, what is best to calm it down? Well, number one, first thing you want to do is you want to drink some water. And when you drink some water, you dilute your urine. The second thing you want to do is alkalinize your urine, maybe with a little bit of a couple of pre-leaves, a couple of Tums, a little bit of baking soda and a glass of water. Hello, YouTube. Testing 1, 2, 3. Hello, YouTube. Can you hear me? You can hear me. Awesome. Okay, so we're back. So that's this microphone. Okay, so number one, when you're having a diet-induced flare, you're going to dilute your urine. Drink some water. You know, when you are dehydrated, your urine gets super concentrated and dark and irritating. So now you've got to dilute your urine. Second thing we want to do is alkalinize our urine. And you can do that with a pre-leaf. Right? You can do it with a little bit of pre-leaf. Or a Tums. Or a 1/4 teaspoon of baking soda and a glass of water. That would work. And then you're going to have to ride it out, you know. And so you could use azo bladder pain relief tablets. Azo bladder pain relief tablets. This is the generic for pyridium. All right. And so this is the stuff that turns your urine orange. And what it does is it numbs the bladder wall. I will say that for me personally, when my bladder was screaming, it really never did anything for me. You're not meant to be taking azo every day. You're not, you know, there can be problems if you do, but it's certainly something viable for flares. And hopefully within 24 hours, things will have calmed down. Let me describe a nighttime flare. Okay, so that you were talking about the same thing. Whenever I had a diet-induced flare, you would go to bed at midnight, and of course you peed before you go to bed. You wake up 2 hours later or an hour later, your bladder feels really, really full. You go to the bathroom and you pee out maybe 1/4 of a cup. You go back to bed. You wake up a half an hour later. Your bladder feels very, very full, and you go to the bathroom and you pee out a teaspoon. You go back to bed. You wake up 15 minutes later. Your bladder feels very, very full. You go to the bathroom. You push and strain, which you're not supposed to do, and you get a drop. And then you're stuck for hours in this. You feel like you're full even when you're empty. And that, my friends, is the ultimate symptom of a seriously irritated bladder wall from you eating or drinking something you shouldn't have eaten. That is the epitome of a diet-induced flare, and that is the epitome of your bladder screaming, help me, help me. It's with this fake sense of fullness. Your bladder is empty, and yet it feels desperately full. And you know, that's when you've got to do your bladder wall protocol. If you come to our website and you sign up for our free newsletter, you can download our 40-page flare management guide. It has an hour-by-hour rescue plan for bladder wall flares. And it also has an hour-by-hour rescue plan for pelvic floor flares. So, you know, so if you ate something you shouldn't have eaten, or you're drinking coffee every day, which is stupid when you have a bladder wall issue, the last thing you want to do is pour acid on a wound and make it worse, right? We don't want to make it worse. We want to calm things down. But if you have a flare after sex, or if you have a flare after a long car ride, that's not a bladder wall flare. That's a pelvic floor flare. And you're going to have to do a completely different strategy for that. So with pelvic floor flares, yeah, go ahead and drink some water. Keep your urine dilute. That's important. But first thing we're going to do is maybe use some heat, because heat relaxes muscles. Or you're going to take a long shower or a warm bath, or use these great body heat heating pads, or we've got some wonderful, really big microwavable heating pads that you can put right over your belly. The next thing you can do when you're having that kind of flare is a muscle relaxant, like a vaginal Valium muscle relaxant, or baclofen, or Flexeril, or a Valium orally. You can then get your wand and work with your pelvic floor. So hopefully, for those of you who have pelvic floor dysfunction, your physical therapist has taught you how to use this lovely little tool so that you can get in there and relax those muscles. And there you go. So if you're, you have to, there are different types of flares with different types of physicalities. Judy's saying pyridium. No. Leanne said, oh my God, I had it. Damn it. It just moved so fast. Just when I'm reading it. Lisa says, is there any difference between Catholics and Dandy Blend? I love the taste of Catholics, but there's California cancer warning label on it. I've tried both. I like Dandy Blend better. I do. Lori says, can you talk a bit about permanent disability? Sure. I'd be happy to talk about permanent disability. My first job after college when I gave up my pharmacology degree was working for Social Security as a black lung specialist. Go figure. Okay. So, some patients, not all patients, but some patients have symptoms so disabling, you cannot go to work. My first year, I would drive to work crying with every speed bump. And I'd hit the parking lot, the speed bumps in the parking lot, and I would literally almost scream. The pain was so bad. And eventually, yes, I had to go out on disability. And so the first thing I went on was state disability insurance. There's federal disability insurance here in the United States, and there's state disability insurance. They have completely different goals. State disability insurance is a 1-year program. It's in most states in the United States. And the purpose of the state program is to get you back to work. The implication here is that whatever is wrong with you will get better eventually, and this is to help you during the transition. So with SDI, state disability, that comes out of your paycheck, and that's when if you're in a car accident or if you have a baby, or you need a hip replacement or something like that. That's when state disability insurance kicks in, as long as you were employed and you paid into the system. Laura, that's a great question. Hold on, I'll come back to that. I will try to remember. If your condition is so severe that your doctor does not believe that you will ever be able to work again, that is when you go to federal insurance, Social Security disability insurance. And again, the implication behind that is that you have worked for a minimum of 10 years, you've earned 40 quarters of coverage. If you're in your 20s, there's an adjustment for there, but it's a paid insurance program. You must have paid into the system to be eligible to get Social Security disability. That's different from SSI. Supplemental security income means that you were born with a birth defect. You were born with a profound disability, like being blind, something like that, where it was just impossible for you to have worked anyway. So supplemental security income benefits are extremely minor, extremely low, and they're designed for people who are really profoundly disabled. Social Security disability is based for those people who have worked and paid into the system. Understand that as somebody who was in that system for a year before I went to grad school, it is a profoundly unfair system. 90 to 95% of initial applicants will be denied automatically. Man, you fill out your application, you have your interview, and a tip to the wise, it's important to do the interview over the phone rather than in person. Because when you're in person, they're studying you. They're studying you. If you go there in person for your interview, for God's sake, don't dress up and put your makeup on because you're going to look fine. And they're going to look at you and they're going to say, gosh, this person does not appear to be disabled. And God forbid you don't get up to and go to the bathroom in that hour-long interview. They're going to go, well, she clearly doesn't have a bladder problem. She didn't get up and go to the bathroom, or he. So the experts in IC, and I've worked with several over the last 25 years, say that it's in your best interest instead to do, sorry guys, to do your interview over the phone. We have an extensive disability resource center right on our website, icnetwork.org. Go on over there. Also, if you're lucky, your employer may have their own private disability plan. My employer had a private disability plan. Unfortunately, I could not access those benefits until I was approved by Social Security. And because I wanted to go back to work, I simply did not apply. I did my year of state disability and then I was back to consulting. Understand that, yes, being on disability is a lifeline. But we really want to try to get you to have a normal life too. And I don't know about you, but I wanted to work. I was appalled that somebody would think of me as, like I had that doctor say to me, you will forever be a burden on your family. Okay, this is your life. Get used to it. You'll always be in pain. I was damn well determined not to do that. I wanted to work. And so I never walked into that system expecting lifelong benefits. But also understand that my IC was it was now, we clearly know what it was. It wasn't as severe as some of you. So it's a very personal decision. If you want to do it, go for it. Understand that they will automatically deny the vast majority of patients. That's normal. It's nothing personal. All they're trying to do is to get you to give up. I mean, that's intentional. Because about half of you just simply will not go through the appeal process. For God's sake, go through the appeal process. That's when IC patients are usually approved. You do a reconsideration first, give them more medical information, and then you might even be able to go in front of an administrative law judge. And that's when it works. Now, let me tell you one story about Social Security disability. We had a patient, and I forget her name. I did a big story on her on our website, who literally was turned down all the way through the appeal process. And she ended up in front of a federal judge and she won. And she won like 5 or 7 years of back benefits. It was amazing. She was denied almost at every step because they didn't believe she had frequency. Now, y'all know that's ridiculous. Frequency is the number one symptom of IC, right? It's the first nerve that turns on, the last nerve that turns off. The very first doctor reviewing her case and the Social Security worker reviewing her case said there's no proof she has frequency. And then the next appeal said, well, the doctor didn't report that she had frequency. The doctor didn't observe she had frequency. Therefore, she didn't have frequency. And then they appealed that, saying it's completely unrealistic to think that a doctor would be able to observe your nighttime frequency. And that's why she won at the bitter end with the federal judge. And that's why you having a voiding diary in your medical records is so important. If she had voiding diaries that she'd given to her doctor once or twice a year, proving frequency, she would have been approved at the first or the second appeal. But she missed that part. She missed that part. Somebody said, do I believe in broth testing? Not so much anymore. We do next generation DNA testing. That's the best of the best now. So when you're applying for Social Security disability, understand that the evidence that you provide will support your case. You need a voiding diary to establish frequency urgency. Having pain diaries is really helpful, and you got to have a doctor who believes it. Lori says, can you talk about new treatments coming down the pipeline for IC? You know, it's really now about subtyping, huh? The correct question is, can you talk about new treatments coming down for the different subtypes? So do we have a new treatment for Hunter's lesions? And the answer is, yeah, we have a new treatment that heals Hunter's lesions. It's just not available. It's called Liris, Liris. Do we have a new treatment coming down the pipeline for estrogen atrophy? No, because the way we're going to treat that is with a little bit of topical estrogen and a chondroitin-based supplement or a bladder installation. Do we have a new treatment for pelvic floor dysfunction? They're always working on new things here and there. There's one thing where you can sit on a chair and it will do something. Do we have new treatments for pudendal neuralgia? Yes, that's where some of the sacral neuromodulation and pudendal neuromodulation are really shining. Do we have new treatments for chronic overlapping pain conditions? We're learning so much about that now that I'm sure they're working on stuff, but that's where we're working on reprogramming the central nervous system. People with chronic overlapping pain conditions like IC and IBS and vulvodynia and Sjogren's syndrome and TMJ, and I mean, I'm in this group. It's all about central sensitization. And I've talked about this extensively since October because I attended a big conference. I can go into that in a little bit if you want. Anyway, patients with chronic overlapping pain conditions, essentially, our central nervous system is stuck in fight or flight. We're not calming down. The brain isn't calming down. That's what the brain studies show. But it's fixable, which is very, very exciting. There's a real happy ending. It's just kind of a 10-minute talk, and I don't want to quite do that right now. All right. Let's see. YouTube, you guys are doing okay with your sound? All right. Sorry. All right. Jody says, sounds like we need to work with a naturopathic physician or functional medicine. No, not necessarily. I mean, I think you need to walk into that appointment so knowledgeable, so informed about the many different things that can be triggering this, that you have a really reasonable checklist to work through. We've got to work through that checklist. So any good doctor at your very, very first appointment would not only be taking your history and doing a urine culture or next generation test, they should also be checking your pelvic floor. We should be asking about your periods and things like that. We want to understand the entire landscape of the pelvis now, because so many of you have completely normal bladders because it's really not your bladder. The bladder is the secondary victim of another dysfunction in your pelvis, like a fibroid tumor pushing on your bladder, or endometriosis, or Tarlov cysts, or pelvic congestion syndrome. Billy, thank you so much for the 50 stars. Guys, if you find these support group meetings helpful, one of the ways that you can continue to make these happen is by on Facebook. You can send me stars, or guys, come on over to the IC network and, become a member and get our magazine. You know, this is this is the latest magazine we did, that I did, because I'm the editor and I write, usually at least 50% of it, sometimes 75% of it. This is by far the most important and comprehensive magazine we have ever done, because I have summarized all the new information and data we have on chronic overlapping pain conditions. Why does this happen? Why is there a group of patients who continue to have pain condition year after year after year? It's a different part of their body. The data is nothing short of astonishing. If you go back like 2 months to these live streams and watch the recordings, you're going to find my discussion of that. And one of the reasons we're doing this testing today is I'm trying to improve the quality of the recordings. So we're actually streaming on 2 different internet services. I've got YouTube and AT&T over here. I've got Facebook and Comcast over here. So here is that article, future story. Whoops, chronic overlapping pain conditions. There's our New Year's affirmation. See? So I had somebody call and said, again last week, and they were just stunned at how comprehensive it was. So when we write these magazines for you, they're for a year or sometimes 3 a year if we have a delay. I want you within 5 minutes to find something that you can try or talk to your doctor about. And we achieve that with these. Also in this magazine is a story on our COVID-19 IC research, which is continuing to go. If you've had COVID and IC, please participate in our COVID survey, because we are finding that 75% of IC patients who get COVID report that their IC symptoms are worsening. And for 25%, it gets very, very severe. All the more reason to wear a mask and be safe. We also cover the latest research. We cover Ehlers-Danlos syndrome, flare management tips for the year, because it's my New Year issue. What else do we have in here? And various food stuff and stuff like that. 10 tips for managing medical costs. Anyway, come on over to our website and check it out. And if you're already a member, you can download this on your member page, or it's already been mailed to you. It should have been mailed to you a month ago. Laura says, I'm getting up 10 times a night. My IC it's never been that bad. Why? I thought maybe it's infection that isn't being picked up on culture. Can everyone have low levels of E. coli in their urine? As I had a broth test and that was picked up. I mean, that's where the urinary biome is a bit of a mystery, is we still don't quite understand. The urinary biome changes depending upon where you sample urine from. The urethra has different bacteria than the bladder. Different bacteria compared to your vulva. That's why they want you not to, they want you to hold things apart so that you get a good stream. And also time of day. The time of day you collect your urine sample will also influence what they find in your urine. But Laura, I think that the pivotal test really is a next generation DNA urine test. If you go over to bladderhealth.org, bladderhealth.org, it's a website I built on that a couple years ago. It has a lot of videos of doctors using it now. We had a big lecture at AUA last year by Curtis Nickel, one of the top IC researchers in the world, who basically flat out said that next generation tests will be replacing typical urine tests shortly, because typical urine cultures are simply not good enough. They don't identify enough. Hello, Cindy. Yeah, girl, it's been a while. How are you, hun? Laura says, I have triggers. I can't eat chocolate, dairy, or too much coffee, or I flare up. The only thing that helps me is taking Azo and drinking water. That sounds like bladder wall-driven. Elizabeth reports that she had the vaccine. She got both shots and there was no effect on your bladder. Awesome. I wouldn't expect the vaccine to traumatize the bladder to any great degree, but I did have one patient email me who did say that she flared for a week after having the vaccine. Guys, seriously, you really have to compare pros and cons. It's a very personal decision. When I look at our data collected from IC patients who have had flares or have been taken out of remission after 20 years because they got active COVID, I don't want that to happen to me. And so when I can, I fully intend to get the vaccine. I just can't. I'm too young. Jill, can you get the next generation urine test in the United Kingdom? I know Microgen actually works with patients in different countries. So if you go to microgen.com or go to bladderhealth.org, I'm pretty sure that they can get it to you. Mary says, can a cystoscopy alone show the bladder wall? And the answer is absolutely, but it's not specific enough to see minutia. There's a specific type of machine they can use called narrowband imaging. If they do a cystoscope in the office with narrowband imaging, they will be able to find and identify Hunner's lesions. And that also is the future. The goal, at least from the American Urology Association, is to not traumatize the patient. They're doing everything they can to reduce trauma. And having a hydrodistension is traumatic, even a low pressure short duration. And so that narrowband imaging cystoscope really is the future because it's a very easy way of examining the bladder wall. Laura says, can you take pre-leaf daily? And the answer is, yeah, but don't take more than they recommend. I mean, some people eat pre-leaf like candy and they get a massive amount of calcium and that ends up in their bloodstream and they end up with kidney stones. That's not smart. You know, take it when you need it before a meal and follow the dose. You know, I believe in I come from a less is more approach, my friends. A less is more. I don't believe in taking double or triple doses of anything. I don't. And again, Jean says you probably have chronic infection. Unfortunately, the National Health Service doesn't give high enough doses. But again, the question is what type of infection? Is it a chronic fungal infection? If it is, antibiotics would be pointless. If it's virus, then antibiotics would be pointless. But I apologize because you guys are all talking to each other and I'm butting in and so I might be missing something there. Marisol says, is there a specific bottled water that's better than others for the bladder? A lot of people talk about Evian, but it's expensive. I mean, just look for a good sparkling water. You don't want a water that comes from a city well. You want real sparkling water from like Arrowhead or, you know, one of those good brands. Fiji, yeah, Fiji's an idea too. People, you guys keep hearing about hydrodistension for diagnosis. Well, years ago, in the old diagnostic criteria for IC, specifically for research studies, they required a hydrodistension. They required looking at the bladder and seeing Hunner's lesions or petechial hemorrhaging glomerations. But if you look at the new AUA guidelines, they pulled that out. The glomerations don't mean anything anymore. They think that that's just from the procedure itself. So glomerations have been put aside as a finding of IC. And, you know, instead, it's a diagnosis of exclusion. The only time that the AUA recommends hydrodistension be done is if your diagnosis is in doubt or they think you have Hunner's lesions. I think one of the reasons why hydrodistension is really meaningful is if you have a lot of blood in your urine. If you've got a lot of blood in your urine, hell yeah, man, you want somebody to look in your bladder and see if they can figure out what's bleeding, like a Hunner's lesions or potentially bladder cancer. So there is, you know, I don't like guessing. I like facts. And if I'm in a lot of pain, I really want somebody to look at it. And so if, you know, normally a doctor wouldn't suggest a hydrodistension for at least 3 to 6 months. They would just say, we think you have IC, here's the diet, here are a few things, send you to pelvic floor, whatever. And if you haven't responded to anything 3 months later, 6 months later, or you're getting worse rather than better, that's when they're probably going to say, hey, I really want to take a look at your bladder and see if we've missed anything. Nora says she worked till she was 65, never felt she was disabled. Like, I never felt disabled. I fought that. I mean, internally in my brain, it's like, no, I'm not, I don't want to do that. I want to work. But having that year's worth of SDI for me, as I got through, you know, until I started getting better, was really important. It just gave me time to breathe. It gave me time to breathe and not force myself to work, even though I was in agony and bawling my eyes out all day at my desk. Patty says, my aunt was denied for disability the first time she applied and she's a paraplegic. Yeah, that tells you something. Marisol says, has anybody had multiple cystoscopies? Do you feel it just irritated stuff down there? Well, I mean, we want to know what the purpose of the system. I mean, I've had two. It's different from a hydrodistension. There's a hydrodistension as compared to a cystoscopy. John says, I've noticed that omeprazole can help with bladder pain. Have you heard of other people saying that they have benefit? Yes, I have. it's triggering something for me from a conference. You know, Prilosec, omeprazole, is known for helping, you know, acid indigestion, GERD, things like that. And I know that in one of the IC protocols, it is strongly suggested. It's not something we talk about very often, though. But thank you for bringing that up, John. Yeah. Let's see. Christina says you can download free pages of frequency urgency pain diaries on our, yeah, you can, right on our website. Every one of our members has a medical records kit that's really, really good that you can download, and it's free on our store anyway. I mean, it's free on our website anyway. Just go to the free downloads page. There is a free download page on the IC network. And there's a lot of good stuff there from the diet. You can download a really huge diet list, et cetera, et cetera. Jody says, I'm running out of mental strength. I hate IC. Jody, girl, you are not alone, but you have never been more prepared to deal with whatever happens to you than you are at this very moment, because you are truly one day older and one day wiser and one day smarter. And so, but if you're not responding to treatment, if you're getting worse rather than better, that's when we want to take a step back and revisit the diagnosis and make sure we didn't miss something. Could you have pelvic congestion syndrome as the root of all of your discomfort? It's possible. Could you have a fibroid tumor pushing on your bladder? It's possible. Could you have Hunner's lesions that were never treated? It's possible. So it always begins with you. You are an anatomical mystery to be solved. We have to study your body to try to figure out what's driving these symptoms. So if you have tight pelvic floor muscles, if that's the root of it all, we have to figure out why. Why are your muscles so freaking tight? And you know, we have this wonderful book, Breaking Through Chronic Pelvic Pain. The book of books of books. And seriously, people, it's free on Kindle Unlimited. No excuses. It's free. This is the best book ever written for people with musculoskeletal problems. And so if you were a bike rider, if you were a dancer, if you had a traumatic injury, if you were an athlete, if you have trigger points, the guy who wrote this, Dr. Jerome Weiss, this is a love letter to IC patients, and it's absolutely life-changing. So one of the things that baffled Dr. Weiss is, why did the pain come back? Why did the pain come back? Why did the tension come back? If you walked into Dr. Weiss's office with trigger points, you would walk out with normal tissue. He was that good at massaging your muscles and getting them healthy. What baffled him is, why did it come back 2 weeks later? Why did the trigger points come back in exactly the same spot? Why did the exact same muscles get tight? Why are my freaking left piriformis muscles always tight? And that's when you have to take a step back and you have to look at the bones. Is the SI joint normal? Mine is not normal. Is there a problem with the hips? We had a research study that came out last summer that showed that 70% of the men with testicular pain, pain in their testicles, bad pain in their testicles, that they all, 70% had an orthopedic hip dysfunction. So now we're doing really good about understanding the totality of the pelvis and how bones and muscles influence organs. So it could be a bad hip, it could be a bad SI joint, it could be a bad knee, and it could be a bad foot. And Andrew says, does bladder builder work for men? Absolutely, absolutely. Laura said, so next generation DNA urine testing is the way to find out if you have a fungal infection or a rare bacterial infection or even a viral infection. Periomics is a company that does viral studies for next-gen testing. Sylviane says, can you do a consult with me? Absolutely, you can. You can go over to our website and to our store and sign up for wellness coaching, and that's paid. People who pay for coaching get priority, obviously. But I do coaching every day on the phone for people who just call our phone line, and they don't pay a penny. I mean, 90% of the coaching I do is for free. But if it's urgent or you want to spend a lot of time, we want you to sign up for coaching. Laura says, UK doctors won't treat on DNA testing. That's going to change eventually. UK is very slow. You know, the challenge with UK and the National Health Service is that your system is controlled by a small group of doctors at the very top who decide what can and cannot be done. But they will eventually move on, and new doctors will come in who will say, hey, there's validity there. Peppermint herbal tea, my friends. Laura says, the video keeps freezing. Now listen, you're on my high-speed Comcast. You should not be freezing. There's nothing else broadcasting. Maybe it's a connection on your end, but this should be a really pristine feed. You guys tell me on Facebook, does it keep stopping and starting and stopping and starting? I'm in a 30-day trial. It's going to cost like $200 a month. So Christina says, Garden of Life, doctor formulated probiotics for the urinary tract. Do you think this would help people with IC? It's got cranberry in it, in the vitamins. Let me look at it. Hold on and let me take a quick look at it. So you're talking about the Garden of Life vitamins? So I'm just going to look at the women's once daily, and let's just take a look at this real quick. And that's going to be probably a no on that because it has tomato in it. It's got citrus in it, lemon in it. That might be a little hard for somebody with estrogen atrophy or chemocystitis to tolerate. I mean, but you won't know until you try. I mean, you want to try one, see how you do, that's fine. Kristen says they want to do a scope because I'm having a lot of urgency. Well, hon, if your urgency is has worsened over time, then yeah, at some point in time, you want somebody to look in your bladder, right? Otherwise, you're forcing them to guess. And sometimes it's important to let somebody look in your bladder. Chantel says, Medtronic's InnerStim is a game changer and helped me so much. Yeah, InnerStim has a pretty checkered history. It's a step 4 treatment option for IC. Actually, it's not specifically approved for IC. It's approved for overactive bladder and incontinence. It has been used by IC patients for many, many years. And it has mixed reviews, quite a few adverse events with InnerStim over time, especially deep tissue MRSA infections. But if it's working for you, girl, power to you. If it stops working, if you start getting shocked, if you have anything unusual, you go through a metal detector and you get a shocking feeling, please make sure that you talk to your doctor, okay? You should not be shocked using any neuromodulation device. Mary says, can atrophy cause the bladder wall to thin? That he can't see with his cysto. I know they can see estrogen atrophy in the vagina. I don't know how they would see that in the bladder. I don't know. Now, Kathy says, I keep freezing. I don't understand why. I'm not freezing on my end at all. Borea says she's going for Dmso treatments this week. Okay, so Borea, Dmso is certainly fallen out of favor over the past several years. Most doctors prefer to do a rescue installation with heparin and lidocaine. The challenge with Dmso is it hurts. It can hurt. It can hurt, it can hurt for days or hours. If you are going to have a Dmso or any bladder installs, for God's sake, do not try to drive home with it in your bladder. Sit there for 20 minutes, 30 minutes in the waiting room, pee it out, then go home. I tried to do that once. That was a horrible mistake. I had 8 Dmso treatments, did nothing for me, but then it didn't help my subtype. So my subtype's very different. So, at some point in time, you get to say to the doctor, I mean, the treatment protocol for Dmso is 8 installations. And if you're not any better after 8 installations, you move on. If you do show improvement after 8 installations, they might be able to repeat it, in 6 months. But really, you need to say, hey, man, this is really painful. Can we try something else? That's why the rescue installations are so important. You can walk out of the doctor's office pain-free. That's why they call it a rescue, because you're rescued out of flares, right? Right. All right, here, hold on, YouTube. It's so weird having 2 different cameras. And I know my eyes are weird. I keep looking down on my YouTube screen. All right. Maricel says, if you're on menopause, estrogen atrophy, let's see, is estrogen helpful for the bladder? Yes, it can be. Google the genitourinary syndrome of menopause. Kirsten says, I use anything from Tums to Nexium. The Tums I take throughout the day with a lot of water, so I don't get kidney stones. Okay. Chantel says, is there any correlation between IC and endometriosis? There's huge correlation between IC and endo. Huge correlation for a couple of different reasons. But you have endometriosis that's attached to your bladder, squeezing your bladder, going through your bladder wall. Absolutely. Endometriosis is also very painful. That's going to cause your muscles to get tight. If your muscles are super tight, it's going to restrict blood flow to your bladder, and bam, there you go. Christina says, so about a year ago, I had a nasty bladder infection and kidney infection that landed me in the ER. The doctor on call had a scan done, and they saw air in my bladder. I just figured it was from a bacterial infection being present. So now my urologist wants to see if I've got a hole in my bladder. I'm going to be doing a poppy seed test next weekend. Have any of you ever heard about the poppy seed test before? If I pee the poppy seeds in my urine, I guess that means I got a hole. So are they thinking that maybe you would have a hole between your bowel and your bladder? A fistula? That's what they would call it. That'll be very interesting. I can't say the only people that I've worked with that have had holes in their bladder are people who have had traumatic injury. Can I show you the book again? Yes. This is the book, Breaking Through Chronic Pelvic Pain. This is the book for musculoskeletal pelvic issues. And then we released another book. This is, if you don't know what the hell's wrong with you, and you really don't think it's your bladder, but you're just baffled as to why you're having pelvic pain and bladder pain, this is the book to get. It's brand new, hot off the press. This is from Massachusetts General Hospital, also known as Harvard University. And I was invited to contribute a chapter, which is super, super exciting. And so this has national experts in the bladder, the bowel, the reproductive tract, the bones, the nerves, and they go through every possible condition And so this is kind of like a checkbook over and over and over again of all the things you can rule out to try to figure out why you're struggling with pelvic pain. And again, my friends, it's free on Kindle Unlimited. It's freaking free. No excuses. If you're baffled, if you don't understand, if you're not sure if you have endometriosis or stuff like that, there you go. You know, it sounds like Facebook's having an issue. You guys keep saying it's freezing. I don't know what else I can do because on my end, it's not freezing at all. At all. Yes, I'm sorry, you guys. YouTube says, show us the book. Facing Pelvic Pain by Dr. Elise Day. It's a fabulous book. Really. We have waited for this book, I kid you not, for 25 years. If you just simply do not understand what's triggering your symptoms, you need to go through every chapter of this book and it will rule everything out, in or out. Hello, Sam. Nice to see you. Do I recognize you, Sam? All right. And then the other book for you guys, again, on YouTube, Breaking Through Chronic Pelvic Pain. They're both free. They're good. They're good. Do not assume that your symptoms are coming from your bladder, especially if your bladder is normal. Your bladder can be a secondary victim of another dysfunction. So let's see. Does diet affect Hunter's lesions? The worst. The worst. Diet absolutely affects Hunter's lesions. All right. So Facebook, y'all are messed up here. You're stopping and starting. If you're on Facebook, you can come on over to YouTube. I don't know what to say. They might just be having an issue. Christina says, my pelvic floor muscles are too tight. My urologist says everyone carries their stress differently. Some get headaches. Some carry stress on their shoulders and their back. For me, I get stressed out and my bladder starts to hurt. I get constipated too. So when you're startled and when you're in fight or flight, part of your reaction to that is your body is going to tighten all of your muscles to prepare you to run or fight for your life. And the pelvic floor muscles play the critical role in you running. So your pelvic floor muscles are often going to be extremely tight when you're under stress. Hello, Susan, surviving in Texas. Marisol says, what do you recommend for bladder pain? Mine is not so much urgency. I only get that if I eat forbiddens. Well, I mean, again, we have to understand what's triggering it. If you have Hunter's lesions, we have to treat the lesions correctly. Or you can try the palmitoethanolamide, also known as the Piora, because we have that one study from Italy showing that PEA and resveratrol was pretty successful at reducing pain. But you have to do it. It's not going to work overnight. It takes a couple of months, according to that study. Laura says, can mast cells cause IC? No. What mast cells do is they cause irritation in the bladder wall. You know, the word IC doesn't mean anything, really. The question is, the correct question is, can mast cells cause bladder pain and bladder discomfort? Yes, because you have mast cells in your bladder, and if you say have estrogen atrophy or Hunter's lesion, urine is going to get down into the meat of your bladder where there are mast cells. They're going to release histamine and cause pain. People are asking about allergies. It's very common for IC patients with allergies to flare during allergy season. Very, very common. Mary says, what subtype is Dmso treating? I see subtype 2, but the data is pretty, well, there's a new study again. You know, some studies say it works, some studies say it doesn't work, but it would be for, I see subtype 2 bladder wall driven. But again, if it's chronic infection, it wouldn't make any sense. If it's, you know, if it's chemical irritation, Cindy says, is depression linked with pelvic pain? Sure. Depression can happen with anybody who's struggling with pain and doesn't understand their diagnosis. Marisol says, endo is the illness that keeps on giving. Susan is on Facebook. She says there is no freezing. So again, guys, with the storms and with what's happened in Texas, yeah, I'll understand the internet network is highly stressed right now. So the odds are, I would bet from a location standpoint, for those of you who are streaming, you're probably in the same part of the country. Mary says, does Elmeron help with bladder wall repair? No, it does not. With Hunter's, no. I don't know any doctor who would say that. Hunter's lesions require lesion-specific therapy. And Elmeron is now linked to eye disease, so Elmeron's pretty much off the table for many patients now. All right, so now we need to, I'm going to go ahead and start our Zoom meeting. So hello YouTube. I'm sorry, I'm not ignoring you. So guys, what we do is we start Zoom up, and this is where you get to come in and ask questions. And I'm going to leave Facebook and YouTube on so y'all can hear this. So let me go ahead and set up Zoom. So an easy way for you to get into the Zoom meeting is to just go on over to icnetwork.org, go on over to our website, click on the support pull-down menu, which is on every page, go to the second link, streamed support group meeting. And the third link under where is the Zoom channel. That's where I'm going right now. And I'm formally launching the meeting. Righty. Then let me post invitations. And if y'all want to do it, that's fine. If you don't want to do it, that's fine too. I am Miss Flexible. Alrighty here. So hold on a sec. All right, Facebook. Lisa says, besides hydroxyzine, is there another antihistamine recommended? Hydroxyzine has two forms, hydroxyzine HCl, known as Atarax, and hydroxyzine pamoate, known as Visceral. And it is the pamoate that is the one that is the most successful and causes the fewest reactions. All right, hold on a sec here, YouTube. Give me a minute. Since you're on a different computer, I gotta go to you a different way. All right, YouTube, here you go. There's your link. Whoops, hold on. Come on in if y'all want to ask me some questions. I'm going to let you in one at a time. So feel free, and let's just give it time for a potty break. Anybody need to pee? Now is the time. You can go use the restroom. Let's just give it a couple minutes and let's see if anybody wants to come in and do Zoom. Patty says, I highly recommend doing the Zoom. Being able to talk to Jill was so helpful for me figuring out my subtype and getting on the right track. Okay, we're going to let Taryn in. We're going to let Mary in. If you guys can just hold tight for a couple minutes. Hi, Mary, I can see you. Kirsten, thanks for mentioning the Benadryl, Zyrtec, and Claritin. But, you know, wasn't there an alert about the Zyrtec? I swear I saw, what was that? Yeah, Zyrtec has as of March of last year, there are serious problems with high doses of Zyrtec. And so there is now a boxed warning on Zyrtec. Let me grab that link and I'll put that in there so you can read that. So you guys, you want to be careful with the Zyrtec and Benadryl. I can't take Benadryl. It makes my heart race. Hello, Mary. There's our second Mary in our Zoom meeting. There you go. There is the link for the FDA issue for whoever asked about that. Let me copy this invitation again. Okay, Jeannie, here's the link. It's another new link. You can come right in. All right, guys. So let me just say this, that YouTube, y'all are going to hear this. Facebook, you're all going to hear this, but I'm not going to necessarily see what you're writing because I'm going to be looking at Zoom now. And so bear with me here. I try to. All right. Hello, everybody. It's nice to see you. Let us go to Mary without a last name first. Hello, Mary. How are you today?
Hi. Can you hear me?
I can. And let me just turn my volume up so people can hear you.
I guess I don't have a last name. I wasn't aware.
Hey, so could you do me a favor and turn if you can turn around so that the light is shining on your face?
That's better. Huh?
Yeah, much better. Ooh, look at how pretty. Look at how pretty you are, and what a beautiful sweater you're wearing. Oh, that's gorgeous.
Thank you. I think I've worn it for 4 days. I left the house.
Yeah. Well, hon, how are you doing today, and how can I help you?
Hi. You know what? I have a really complicated case, and
Okay.
I'm not doing well.
Okay.
At all, actually. I'm not really sure where to start. I guess I'm trying to figure out what type I am from these different types.
Okay.
I have multiple like possibilities that I could be, like one of many, it seems. So I have been diagnosed with vaginal atrophy. I'm 57.
Okay.
So I definitely have that component, and they thought that was where all my bladder issues were coming from.
Okay.
But no estrogen has been working for me. I've had 2 cystoscopies in the last 3 years, not with hydrodistension. So that's why I was asking you all those questions about hydro, because it says, like, stuff I've read says that you need that to show, like, I'm wondering if I have hunters, but my cystoscopies, which I believe were just regular cystoscopies, the doctor said there was no inflammation. Nothing showed up.
Okay.
Then most recently I got very bad in September.
Okay.
I never have flares. I'm just constant 24/7 pain.
Okay. Okay. So let's talk about that for a moment.
I have pain when I fill, like you were talking about before. That's another thing. When my bladder starts to fill, I get pain until I release it, and then I feel a little bit better. But if I can't release it and I'm stuck, say, in a car or out in this COVID world where you can't find a bathroom,
right?
I've had to pee in like IKEA parking lots because it's been so urgent.
Okay. So number one, how old are you?
I'm going to be 57 in like 3 days.
You do not look 57 years old.
Oh my God. My lovely daughter said that to me today, and I said, I feel 87.
No, you don't. You don't look it. That's for sure. How old were you when this all began?
I'd say it started very subtly with frequency, probably like 8 years ago, but I didn't really notice it. It was just more frequency.
So in your late 40s.
Yeah, I went into early menopause at 42.
Okay.
So I've been without estrogen that whole time. So.
Okay. Okay. And where is the pain located?
I have a lot of burning that I can't really decipher exactly where it's coming from.
Okay.
Oh, yeah.
So
over my pubic bone, pressure.
So it's right here.
Yeah, right there. And like pressure feeling. But you know, it also has gone into, it feels like it's almost spread into my hips and my buttocks, like all that area.
Oh, you're
burning in the urethra too, or burning down there.
Well, let me get my handy dandy model for you. Hold on a second. Do you ever have burning while you're peeing in your urethra or on the vulva? We call it urine burn.
The burning is after I pee.
Okay.
But it kind of stays with me the whole day. So the burning actually doesn't go away. It's kind of there.
Is the burning always on inside your body? It's never on your skin on the outside?
No, it doesn't feel on my skin. It feels more inside, or possibly urethra.
Okay. Okay. So, you know, you and I, we are both of a certain age where we remember, I don't know, are you in the US or are you in Canada?
No, I'm in Canada.
Okay. So years ago when I was in elementary school, we had something called the President's Physical Fitness Test. And when we were in elementary school, we were required to do pull-ups and run around the track, and we got awards if we did it. I never got the award because I couldn't do a pull-up because I was a pretty chunky little kid. When you go to run, what happens? Within a period of time, if you were to go try to run around the block, your leg muscles would eventually start burning because you're working them hard, correct? So so that burning is coming from the production of lactic acid in the muscle tissue. So when you're running, you're getting burning in your thighs, you're getting burning in your hamstrings, maybe in your shins, maybe in your calves, because you're working those muscles. But the same burning happens if you're working your pelvic floor. And so if your pelvic floor is constantly is tight and working hard, they are going to produce lactic acid and they are going to start burning. So remember, when I talk about pain before urination and after urination, if you had pain before urination as your bladder was filling with urine that is relieved by urination, that helps us understand that we're looking at the bladder wall.
I have that though. That's what I have.
I know, but I can explain that. That's called a somatovisceral reflex. And so let's look at this. Let's just talk about pelvic anatomy for a moment. Okay, so the pelvis is the center and core of the human body, right? It has the largest single cells in the human body, the hip bones. Why? Because the purpose of this bony structure is to carry the weight of your torso. So it's the pelvis is playing a critical role in how we move and how we carry ourselves. But we also have pelvic floor muscles that go from the thighs and the hamstrings right also up directly into these muscles. So we also know that the pelvic floor is going to absorb the stresses from when we're walking and running and jumping and you know, falling, whatever. If you're a runner, those pressure from the impact of the concrete will deflect right up your legs, right into your pelvic floor. So it's getting it from the top down, from the top down and from the bottom up. And then, of course, we have to look at what's inside of the pelvis. So inside of the pelvis, we've got vagina and uterus, right? We've got, hold on. I got to put my muscle on here. I got to put my levator on. My levator is the attachment point.
You lost the vagina.
I did. Well, I lost my levators. Okay. So actually, before we even do that, so here is your pelvic floor muscles. They're very shallow. We start with our shallowest ones first. These are your levator muscles, right? So these you can see how shallow these are and thin these are. The levator muscles are the only muscles in the human body that control major bodily functions because you have to pee and poop and have sex through them. And so the levator muscles have three core holes in them. There's a hole for the urethra, there's a hole for the vagina, and there's a hole for the rectum. If this muscle is tight, it is going to start squeezing these. And that is why people with tight muscles will struggle having bowel movements because their muscles are not relaxing enough to let things out. And the same thing is true with peeing. That if you're sitting on the toilet 5, 10, 15, 20, 30 seconds before you can relax enough to pee, That's because this muscle group, your levators, are tight. If sex is painful, if penetration with sex is painful, that's because the levators are tight. Okay, but we have 3 layers of muscles. So where every joint is, we got shallow, mid-level, and deep. So these are the shallow muscles. Then we have mid-level muscles down here. And then we have a deep muscles, very deep up here, piriformis muscle and obturator muscles. So
yeah, a lot of my pain is I can feel it even when I'm sitting, like sitting driving, and like I can feel it in my.
So do you have pain when you sit down that is relieved when you stand up?
I wouldn't say anything is ever completely relieved, but it's definitely worse when I'm sitting,
Okay.
and it seems to trigger my having to go to the bathroom.
So let's talk about 2 reflexes here in the pelvis, and this is important for everybody to understand. And let's rebuild this pelvis. So look, I've put the levators on, and the first thing I'm going to do, and this is for a female model, I should have a male model too, is I'm going to put the uterus in and the fallopian tubes. Okay, they're now in. I'm going to put the bladder in. So look, you can see why you would have pain right above your pubic bone for people with bladder wall issues, because your bladder is kind of sticking out right there. Mm-hmm. We're going to put the bowel in. The bowel goes in to the side. It's actually remarkably hard. And then what else do we have going on in the pelvis? We've got a lot of blood vessels coming through here, and we got a lot of nerves coming through here. So as Dr. Weiss says in his book, Breaking Through Chronic Pelvic Pain, Western medicine fails the pelvic pain patient. Why? Because specialists stay inside their box. Yeah. Urologists stay in the urinary tract. Gastroenterologists stay in the bowel. Gynecologists stay in the reproductive system. And they don't understand relationships. They don't consider relationships. So as Dr. Weiss explains in his book, there are 2 fundamental reflexes in the pelvis. So you know how when the doctor hits your knee and your leg flies up, that's a reflex. So there are 2 fundamental reflexes in the pelvic floor, in the pelvis. One is called the viscerosomatic reflex. And basically that is, can an organ like the bladder change the behavior of the levators? And the answer is, oh yeah, definitely. If you're screaming in pain from a bladder infection, your spinal cord is going to respond by tightening all the muscles in the area to prevent you from hurting yourself more. That's called the guarding reflex. So if you have pain anywhere in your pelvis, from endometriosis, from hemorrhoids, from adhesions, whatever, anytime you're in pain, your spinal cord is going to respond by tightening muscles in the area, but then your brain's also going to get involved with that whole brain response. So we know organs can change muscle behavior. But there's a much more interesting reflex, and that is, can the levator muscles change bladder behavior? And that's called the somatovisceral reflex. So viscerosomatic is viscera for organ, soma for muscle. Viscerosomatic, can the organ change muscle behavior? Now we're going to do the opposite. Can muscles change organ behavior, also known as the somatovisceral reflex? And the answer is yes. So so here we go. Imagine somebody who rides a bike, and their bicycle seat is pushing directly into the levator. There's no bony structure protecting this area. When you sit on a hard bicycle seat, you are pushing right against muscle and nerve. And I mean, there's really nothing to protect you there. Or
I guess when you're sitting down, right? I guess even when you're just basically sitting.
Right. Like, they call sitting the new smoking, because sitting also over time you can get cumulative damages. So let's say that you jammed your crotch in the bar of a bicycle. So what's going to happen is now we have a compression injury of these muscles. The muscles have now been squeezed. So 200 pounds, 150 pounds land directly on the levator and this muscle group right here. So now we have squeezed, injured muscles. Those muscles are now damaged. And you may also have bruising. And bruising is the blood vessels have been ruptured by that fall. And also the blood vessels that support the nerves can be injured in that fall. So this begins a whole cascade reaction. So we've got a compression injury, we've got muscles that are damaged, muscles that are weakened, muscles that have trigger points because they're weakened, and a trigger point is a long-term compression injury. We have a restriction of blood flow. So guess what? This tight muscle, now that patient can't pee, because the levator's tight, they can't pee, but they think it's a bladder infection. It's not. It's a tight muscle in some circumstances. The more dire situation is that a muscle, a nerve that's deprived of blood flow is not normal. It cannot be normal. And that dysfunction in that nerve spreads to other nerves, and it spreads to the nerves that support the bladder. And so we start seeing maladaptive nerves here, and then the maladaptation spreads up to the spinal cord. And then because the nerves for the bladder also enter the spinal cord, the nerves at the bladder can also become what we would call maladaptive. So what does that do? Hello, frequency. It's hard for the bladder to be healthy if it doesn't have good blood supply and good nutrition. And it's also hard for the bladder to be healthy if those nerves have been damaged in some way. And we have something called allodynia, where the injury might have happened 2 or 3 inches away from the bladder, but eventually the nerves in the bladder become involved. So
I have that actually. I have allodynia. Right. I have it all over my body, the central sensitization, right, which I believe I got from this being sort of misdiagnosed, undiagnosed for an extended period of time. So it's created this whole body.
Well, right.
Now. So that's a whole other issue, but.
Right. Okay. So to kind of wrap this up here, the most important question here is, have you had a pelvic floor assessment?
I would say not completely. I've gone to a pelvic floor therapist, but I've been so afraid to have them even touch me, and they've been afraid to touch me because I'm in so much pain. So,
well, I mean, but you've got to let them try. Even if they don't do internal, they can start external. They can look at your
whole body hurts with the allodynia. So like when you touch me anywhere, I'm going to hurt, right? So it would be unusual for them to touch me anywhere in my pelvis and not have it hurt, is what I'm saying. It would probably be positive anyway, right?
Well, but it's not just that it's painful. It's what's the consistency of the muscle. Is it tight? Is it chunky? Is it flat? You can see from this model that the muscles are in essence flat. They're wide and flat. But when they get tight, and I don't know if I can do this. No, they're so when my pelvic floor muscles get tight, they lift up and they become taut. And I can feel it. I can absolutely feel it with my wand. So, I understand where you are, but at some point in time, we have to start studying your anatomy a little bit more. I think what you should do is you need to get this book, Breaking Through Chronic Pelvic Pain. Again, it's free on Kindle Unlimited. So
I have it. I got it. Like I've read most of it.
So as you read that book and you pondered your anatomy, did anything strike out at you? Do you remember any injuries? Do you remember any falls? Do you remember anything?
Yeah, I mean, I could trace something that for sure. I've had a couple of bad falls, like tobogganing accidents. I've had a very traumatic childbirth, natural childbirth, which was kind of preceded the beginning of this.
Okay. Okay. Well, so you're forcing them to guess. And that's not, at some point in time, that's not good enough. We need hands on your body, externally at first, studying your legs, studying your back, studying your core, looking for funky tension patterns. You know, you're kind of you're in the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor, and throw in the nerves.
Or the atrophy. Like there's a whole...
Yeah. And so, you know, and it may be that a lot of this was pelvic floor driven from the first place. And then just the estrogen atrophy happened over time. This could easily go back to when you had your baby. And that just slowly over time, the muscles got more and more and more and more dysfunctional. And so to me, the missing piece of your puzzle is letting somebody study your muscles. And the same time, as he talks about in the book, that it's important to work on the nerves. If your nerves are hyper crazy and you're super sensitive, then using a medication like Neuralgia, which would calm nerves down, an antidepressant, which would calm nerves down, and maybe even something like the Peora, the palmitoethanolamide, might also help calm some of those nerves down. So if they can get the nerves calmed down to the point that you can now perhaps work a little bit more with the muscles, that's important. But to me, that's the big missing piece, is we need a finger in your vagina touching muscles, for lack of a better term. And it can be very brief. I mean, they can do it in a minute. It would just be, it would be fascinating. You know, and maybe also too an x-ray, you know, seeing if you had anything else going on in your pelvis that might relate to some of what's going on. So
I've had probably 4 CT scans.
Okay.
So I think that would probably cover the x-ray part. But yeah, I guess I'm wondering whether I need to have another cystoscopy with a hydrodistension to see if there's something going on in there.
I know, but why would you do that? You've already had that done. But see, you've already had that done, and your bladder was normal, correct?
Yeah, just the cystoscopy.
Okay,
yeah.
So, you know, then why go more invasive when you still haven't had the critical fundamental examination, which is your pelvic floor? I mean, girl, they can do that in like 5 minutes.
Yeah.
And that's a missing piece, is we have to know what's going on with your muscles. So
they could tell that from like one visit.
Yeah. Oh, absolutely. Absolutely. They will be able to tell very quickly. I mean, that now a nice pelvic floor examination, you know, the internal examination is less than 5 minutes. Most of it's external. They're going to have you walk up and down a hallway. They want to see how you're walking. They're going to measure your legs. They're going to look for hip patterns or tension patterns, all sorts of stuff like that. So, you know, you got to do that, hon. You have to do that. And the fact that you're having glute pain and pain in your butt and pain around your hips, girl, if it walks like a duck and talks like a duck, it's a duck. You are pointing more towards having a muscular driven issue than a bladder wall driven issue.
That's really where it started, was the noticing when I sat down that my butt hurt.
Well, yeah. I went through, I mean, I have the same issue. I mean, this is I can sit for about 3 hours. I'm stiff as hell when I get up, and I look like an old lady for the first 30 seconds because my legs are so tight. So, well, listen, hon, keep in touch. I would like to keep in touch with you, see how you're doing. If you have any other questions,
We'll have to connect because I have a session coming up with you.
Okay.
I'm Mary.
Okay.
From the phone call, you left me a message.
Okay. Excellent.
Remember?
So yes. We'll do that this week. Not tomorrow.
Yes, we'll have to. I was going to call you, but then I thought just give you the weekend. So
Okay. So we will catch back in touch, and we'll kind of go through other things. But I think the take-home message here for everybody who's listening and watching here is that if you don't let them examine you, you're forcing them to guess. And that's not good enough. It's especially with your muscles at some point in time. Now, I mean, if there's a history of abuse, a history of rape, things like that, we understand why having an internal examination would be very awkward and uncomfortable. And you have to tell your doctor about that. Don't respond to that. I'm not saying that's you. but we have to study your anatomy. We have to study your pelvis, or you have to do that and let somebody do that. Okay. Okay, hon, we will talk again.
Thank you.
Okay, my next victim is going to be Taryn, because Taryn came in second. But Taryn, are you there? Taryn, you'll have to unmute.
Yes.
Hey,
Yes, I'm here.
How are you going to turn your? There you are.
Yeah, I just had it off because I didn't want to be visible and I wasn't talking.
Okay, well, how are you doing today? How is life?
Good. I wanted to say thank you. Because of you, I found out that I had pelvic floor complications. Although I did the physical therapy, the painful physical therapy.
Well, it can be at first, absolutely. Yeah.
Yes, they do it from the inside out. I did not know that until I went in.
But it should get better. It should get better after a couple.
That was over a year ago. So
okay.
It was actually 2 years ago I found you on here, and I went through.
Okay.
I went to my doctor and said, I think I have pelvic floor problems too, because I had recently gone to the ER via ambulance because I couldn't get out of bed.
Ooh, okay. And so how are you doing now?
I went on the elimination diet. I went onto the site and I did all the elimination diet and took everything out of my diet.
Okay.
This said to eliminate it. I eliminated it and I finally got better.
Interesting. Okay.
But I'm on medications as well. All the prescription medications that they prescribe.
Okay. Okay.
Radium.
So
Elmeron.
Wait. Okay, so don't talk about treatments yet. We're still trying to understand your anatomy a little bit more.
Okay.
How old are you?
I'm 43.
Okay. And are you still having your periods?
I am.
Okay, interesting. So when we think about IC subtype 2 bladder while driven, we know that bladder, like any other part of the body, can be injured and traumatized. And so the very first thing we want to look at is was there ever a chemical injury? So did you ever have chemotherapy?
No, it's actually genetic in my family.
Okay, so let me just go through these and then we'll go back over to the genetic side then. So when we look at bladder while driven, we're going to look at chemical injury first. We're going to look at estrogen atrophy second, and or birth control. Because if you're on a birth control method that's reduced your estrogen levels, that can also start changing how your bladder's behaving. Your bladder and your urethra need estrogen too. And we're going to look at chronic infection. But now you just opened the door to genetics. IC subtype 5, central sensitization, is an area where we see more inheritance. So I notice you're wearing a chunky sweater. I can't do that. My skin is too sensitive. Do you have sensitive skin?
I do. It's actually bigger on me, but
okay. No,
I have to put lotion on before I can put it on.
Yeah, like I can't tell you. Like you always see me wearing cotton shirts. I can't do anything. It has to be smooth, even if it's big. Oh, okay. It has to be smooth. It can't have a texture. It makes me insane. Are you, do you have a wicked sense of smell? Can you smell things that other people can't smell, and do smells drive you crazy?
Yeah, I can smell things really well.
Do you have a great sense of taste where you can taste more than?
Yes.
Okay.
I can taste everything.
So who in your family also has sensitivity?
A lot of people.
So you have siblings who are sensitive?
My sister is more like you though. She'll have to wear her clothes inside out.
Okay, right. And I wear my clothes inside out at night. I do.
She does. Yeah, she does bed.
Okay. And how about is it your mom or your dad? Which side?
My mom. It's more my mom's family.
Okay. And what is your ancestry? Just out of curiosity. To me, you look Irish. What's your ancestry? I'm Norwegian.
Mostly from Britain, Great Britain.
Okay, so we're pretty close. And so so for me, my sister has this, my mother has this, my grandmother had this, my aunt, my cousins. Hello, redhead, sensitive skin, right? And I didn't notice all the other sensitivities until my 20s. That's when they really hit. And the food sensitivities are freaky. All of a sudden, a food you could eat as a kid, you just can't eat anymore because it hurts badly. So my guess on this is that it's all about evolutionary adaptation. So if we go back, so an evolutionary adaptation takes 5,000 years to happen. So the fastest cheetahs survived, the slowest died because they couldn't catch food. The fastest antelope survived because they could outrun the cheetahs, and the slowest antelope died because they were caught by the cheetahs, right? So we know evolutionary adaptation occurs, but it takes a long time to occur, 5,000 years. And so our body right now was designed 5,000 years ago. The latest change in our body, in our DNA, our genetics. So what were your ancestors eating, and how were they living 5,000 years ago? I will tell you, the UK had the blandest diet in the world. Although Norway, where I was even blander. I mean, because all they were eating back then were fish, whales, deer, berries once a year, and maybe some greens, and that was it. That's all they could do. In the United Kingdom, it was very similar. Yeah. Okay. And also every tribe needed somebody who could tell if the water was good or bad, who could tell if the food was good or bad, right? And so there's an evolutionary priority to be sensitive. We're the ones who will smell the fires first. We're the ones who will figure out if that's good water or bad water first. So being sensitive is genetically not a bad thing. It's necessary. Unfortunately, today's modern day life, with a worldwide environment and all the chemicals that we're producing right now, are devastating to those of us who are sensitive. I mean, you can't have scented candles in your home, right? Or Febreze, or perfumes, right? Can you get away with stuff?
I can. I just can't use them on like the insides of my clothes.
Okay. Like I can't even have them in the house. I'm a crazy woman. I'm like running and taking it out of my house. So.
And I can't put them in my bath waters and.
Oh yeah. No bubble bath, no bath salt, nothing like that. Nothing with perfumes. It just doesn't work for us. So if I could go back in time and talk to myself in my 20s, what I would have said is, you know what? You're the gift of your ancestors. As I was going through all this weirdness, I just didn't understand what was happening in my body. But once we had the research that came out in the early 1990s that showed that this can run in families, and then we had the research that talked about the nerves, that's what gives us context. And you've been sensitive your whole life. And you've adapted already for your whole life, just like I have, at least since my 20s. Our job on a daily basis is to protect our nervous system. You and I will never be able to do caffeine. It is neurostimulatory. And the same is true probably for chocolate, unless it's white chocolate or carob. Chocolate is neurostimulatory. So you and I on a daily basis have to make a commitment to protect our nervous system. The odds are too, you're not comfortable in a city. You're much happier in the country. Are you?
Yes, I've actually moved to a small town.
Right. Why? Because the smells, the sounds, the scents, everything. It just overpowers those of us who are sensitive. We are happier in a quieter environment that we can control. I was thinking about this. I was like, if you want to torture Jill Osborne, put me in an apartment in a city. It would just be torture for me. For all
that's where I was.
Right.
And I had to.
And do you feel better now? Have things calmed down? Has your nervous system calmed down a bit?
Oh yeah.
Yeah.
Everything's changed.
So you've got, but the reality is you and I have sensitive skin. We have a sensitive stomach. We have a sensitive gut. We have a sensitive bladder. The bladder is healthy. It looks healthy. It's just easier to turn our nerves on. And so, hopefully you're seeing your bladder symptoms calming down now that you're calming down, now that your nervous system is calmed down. Do you notice that your bladder symptoms are better?
I'm in a flare now, but I also have autoimmune issues in my autoimmune because the Midwest has had a horrible, horrible winter last week.
Oh yeah.
So it's flared up. So it also attacks my bladder along with it.
Right.
So
Right.
it's flared up for the first time since it calmed down.
Okay.
But that's gonna happen.
So therapeutically, then, you shouldn't be in much estrogen atrophy because you're 43. I wouldn't expect that yet. Are you on birth control pills or anything like that?
I recently got an IUD like 6 months ago, but I haven't been taking anything.
So we did have one case study that came out last year that was an 18-year-old who started birth control. 2 weeks later, she developed all the symptoms of IC, and over a period of that year, got worse and worse and worse and worse and worse. She was diagnosed with IC. She was diagnosed with chronic candida. She was diagnosed with IBS, all sorts of stuff. It's like the fifth of the six doctors said, "Hey, did you start any new birth control?" She goes, "Yeah." They took her off the birth control. It took about 2 months for her symptoms to go away.
The IUD could actually make me have IC symptoms.
It might. It might.
Okay.
It could.
If they don't subside, then I'll get it taken out.
I mean, but your symptoms didn't change 6 months ago. They changed 2 months ago. So maybe not. So you're going to have to rule out tight muscles. And, it'd be interesting to see when you're cold, things get tight. You've been very cold. You've been under stress. So your muscles could be tight and your bladder wall could be more sensitive. And we have to look potentially at the role of hormones. But that's low. I would consider that fairly low on the list. But those are all things that you could talk to your doctor about.
Yeah, I'll keep an eye on it.
And what all the research studies said about PEA, it was a consensus among the researchers that this appeared to be the best with neuropathic pain. Do you ever go through periods where you feel like needles being poked in your arms randomly?
Hands and feet.
Yeah, just your hands and your feet. So like a neuropathy.
Yeah, I have rheumatoid arthritis.
Okay. So for me
and Sjogren's
and Sjogren's. I have Sjogren's. Yeah. I have Sicca, dry mouth, dry eyes.
Yeah, I do too.
Yeah.
I'll have a little bit of it.
Yeah. Well, so when I start feeling my nervous system getting a little whacked up, and for me, it's pins and needles in my arms. I usually feel it in my shoulders and in my arms and in my vulva. It's very weird. Or just anywhere on my body. It's just like poke, 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 poke. And it's just a random poke, and then 30 minutes later, poke, and then 30 minutes later, poke in random parts of my body. That's what tells me that my nervous system is getting amped up again. And so I use the Peora for that myself. And so that is potentially something that you could play with if you wanted to give it a try.
Oh, I'm going to try it. Yeah.
Yeah. All right, hon. Well, listen, you're not alone. And I hope you get comfort from knowing that genetics are not your fault. You've done nothing wrong. No shame, no blame. You are the gift of your ancestry. So let's embrace it and use it. You're going to be great at making wine. You're going to be great at, the perfect job for you and me would have been making perfume because our sense of smell is so good. So we just have to respect it, protect it, and do everything we can to kind of calm it down. Do the mind-body medicine. Do you have this magazine, our latest magazine?
No, I do not. I signed up though for it.
So go to
White Talking. I went and signed up online.
So if you signed up in our store, go to your member page and download it and read that first article on chronic overlapping pain conditions.
Okay. I will.
Okay. All right, hon. Nice talking with you. Let's keep in touch.
Thank you.
And I hope you feel better.
Yeah. On YouTube here, Ashley said, is it normal with IC when you're on your period to have pins and needles trying to come out of your bladder? Along with lower right back pain and frequency? No. Sounds like you're having strong cramping that could potentially, cramping is from skeletal muscles. That could be in your low back, maybe. But the feeling of needles trying to come out of your bladder, sounds like you're having really bad cramping that might be compressing nerves. Okay, let us go to the second Mary. Hello, Mary. How are you doing today?
I'm doing okay. I was the one that left the message on YouTube about having an IUD removed.
Yeah.
I went to get it removed. I'm 50 years old. I went to get it removed a couple of years ago, and the string broke because it's now, I had to go get an ultrasound. It's embedded in my uterus. So now they're going to have to go in and take it out.
Okay.
And they're going to have to take part of my uterus out with it. Or if it's that bad, they might have to take all of my uterus.
When is this happening?
Well, it was scheduled to happen right before COVID.
Okay.
Because I've been putting it off because I'm afraid of like, they're going to have to put a catheter in me. They're going to, do all this movement. And I'm just was putting it off and off. And finally I had scheduled it and then COVID happened. I'm like, well, I'm not doing it now. I'll wait.
Yeah.
And I had a physical 2 weeks ago, and my doctor said, listen, you have to get this removed because it's just going to get more embedded. And I guess you can get issues through your spine up to your brain. It could, have infection, so that's kind of where I'm at right now.
So it sounds like they want to do a start with a DNC where you're under anesthesia. They go in, they dilate your cervix, and that will give them a good eye view of what the heck is going on in your uterus.
Yes.
Okay. Honey, I had that done.
Did you?
Was
did.
It stuck? No, it was a piece of cake. It was a piece of cake, hon.
Okay.
So for me, we thought that I had started spotting, like pink lemonade spots that over a period of several months got bloodier and bloodier and bloodier until I was passing blood clots. And this was 3 years ago, so I was 57.
Mm-hmm.
And what they found was that my endometrium, which is the lining of your vagina, of your uterus, was getting thicker and thicker and thicker. Normal is 4, mine was 8, cancer is 12. And he said, I need to look. And so we did a DNC. And I was scared too. I was scared because I remembered as a kid, I had a hydrodistension when I was in 7th grade. And I remember waking up in the recovery room with a lady who had just had a DNC, and she was not happy. And I never forgot that. I will tell you that there were 2 things that I did to make that tolerable. The first thing was I insisted on pain medicine. I needed the prescription in my hand at my pre-op. I was not going to wait to walk out of that hospital with a prescription in my hand. It's like, no,
right.
I want Norco. I want it in my hand. And I want you to promise me that you will be here for me with pain care if this isn't enough. And my doctor was not a problem.
Yeah, that's been a big issue. I've had IC. I was diagnosed in 2003. It took me a year to figure out what it was. I thought I had a UTI, and my mom, I was just on the floor, just like, what is wrong with me? She took me to her doctor. He said, well, you don't have a UTI, so I don't know. And just kind of gave me some antibiotics and let me go on my way. And it took me a year of trying to figure it out, going to doctor to doctor. Finally, I found one. But they were always very, very conservative. At this particular time, I had started Depo-Provera a year before I got IC. Mm-hmm. And I never linked the 2 until a couple of years ago.
Right.
Because if it's going to thin your uterus and all that female stuff down there, then it's also going to thin out your bladder probably.
Yeah, you were probably you were probably a hormone driven patient. And what's so funny about that is I can remember going back 20 years ago, there was always a small group of patients who were clearly hormone driven, clearly. And even though that's not a subtype, but again, there's so much debate about subtypes right now. I mean, I just use a system created by Chris Payne. Mm-hmm. Other doctors use different systems, and other doctors don't use anything at all. But in the Chris Payne system, you would probably be a subtype of bladder wall driven, hormone driven.
Okay.
And how long have you had the IUD?
Well, now, I mean, it was a Mirena, which you have for 5 years.
Okay.
So now it's been 7 years.
Okay.
Because
so yeah.
of me putting it off at first
Yeah.
because I was afraid, and then the COVID. So 2 years of the first year was just me being afraid, and now the COVID, and now my doctor's like, just my regular PCP is saying like, you have to get that removed.
Now I'm not a doctor. I can't say you should.
Yeah.
But it certainly seemed logical. I think that I have a rule about being afraid of medical conditions, that I act early and aggressively, because I will sit at home and worry for a long time.
Yeah.
And I will let fear stop me, which is what I did for 6 months after I started spotting.
Yeah.
And even my doctor pushed it off. I convinced my doctor to push it off. And by golly, if I had waited any longer, if I'd let fear stop me even more, I mean, it was just starting to grow tumors when they caught it. And if I had waited 6 months, it could have been much worse. So I think don't let fear stop you. Let it motivate you, because you're just sick of being afraid, right? I mean, that's how I feel about it.
I'm that person.
Yeah.
I freeze. You were mentioning that. How some of us run, or I freeze and I don't do anything.
Yeah.
I think the trauma also with that went along with the IC, especially the first 10 years.
Yeah.
Really has taken a toll on my sensitivities. As you could tell, I was getting a little teary there. I'm very sensitive, and like you said, the skin, everything now, because of the trauma of that pain, has completely turned my life upside down.
Yeah, but here's the deal: you can always count on healing, because your body's wired to heal. That never turns off. Healing is always happening. This is about you creating an environment that will support that healing, and getting that IUD out is going to be a very important piece of your puzzle here. We've got to deal with that. The second thing that was really critical for me with the DNC and my hysterectomy that I had 2 weeks later was when you're in pre-op. Now, listen, I have no complaints about anything that happened to me. Aside from my stupidity holding stuff up, not understanding the gravity of my situation, which is not the same as yours. When you go in for your procedure, they're wonderful. At least where I am, they were wonderful. They bring you in, you put your robe on, they give you a nice warm heated blanket over you. They give you something to kind of relax you when they set up your IV, and you're pretty mellow. And then the anesthesiologist comes in and talks to you. And my biggest fear was that I would not be able to pee afterwards. And I was like, dude, this is going to be a success if I can come out of the recovery room and 15 minutes later I can pee. I do not want to be able to not pee for 8 hours or 10 hours. I want to pee immediately. And he's like, why? And I go, because I have interstitial cystitis. My bladder can be really sensitive. I need to be able to pee. He goes, not a problem. I know exactly what to do to make this happen for you. And I'm like, how? He goes, I'll just use propofol. Propofol knocks you out very quickly, and it wakes you up very quickly, and it is not a deep numbing of those nerves.
Oh, I see.
And I'm telling you right now, I was able to pee 15 minutes after coming out of that procedure.
Good.
Whole hog, no problem.
Okay.
So you can talk to them about that and say, okay, now
I'm worried. Yeah,
but let's address those worries. You need to make a list.
I need to address it with them more.
So if you're worried about that, anesthesia can make that a difference. And then, you're not God. You can't predict the future. I can't predict the future. All we know is that you got it embedded, and for all we know, it's right on the surface. They can whip it out, pull it out, you're done. And that's what we're going to focus on. That's what you need to keep rehearsing in your brain, is do that visualization that they're going to go in, they're going to find it, see it, extract it easily, life goes on, right? Give your brain
I have to become a better advocate for pain care too.
Well,
because
yeah, yeah.
They will basically tell you, well, just take some Advil.
No,
I
and
don't like, no, Advil doesn't touch this. But, you know, I'm not asking for a year worth, you know, I just want a few days.
and
You know,
that's
and
and
they're
that's
just very like, oh, especially I'm in California and they're just like,
no,
you know,
hon, I'm in
very,
California. I had no problems at all getting it. None.
yeah.
I'm in Kaiser. Are you in Kaiser? What's your health care?
I have, I changed insurance recently because my husband and I are splitting up. I see how I ought to do that.
Okay.
I
Okay.
have, oh my gosh, what I have now?
Okay. Well,
I think it's United.
okay, United Healthcare.
Yeah.
So this is, I mean, this is a deal breaker. This was a deal breaker for me. Like, if you want to do that, if you want to do a DNC, that's fine.
Okay.
My demand is pain care. Period. End of story. I'm going to have the prescription in my hand during the pre-op.
Okay.
And they gave me like 15 Norcos, right? I only used it for a day or two at the most.
Right. Right.
And the irony is I went through my entire hysterectomy using that. I didn't even get to the meds that they gave me for my hysterectomy. So, you know, okay. I hope that makes sense.
So,
and then the second thing you've got to do is to ease your worries is go over to a website called Hyster Sisters, which is a fabulous support website for women facing hysterectomy. Sign up for that and read through some of their materials. And your question at your pre-op is going to be, okay, best case scenario is the IUD's on the surface. You can pull it out easily. We're done. Worst case scenario is it's bedded deeply in my uterus and you're going to have to resect my uterus. Okay, I get that. You'll have to stitch it up. You'll pull it out, make an incision, pull it out, stitch it back up. Okay. The last potential situation is they might choose to do a hysterectomy and remove your uterus. So your question is going to be, number one, will I keep my ovaries? Number two, are you going to do, and how are you going to do it? I want the least invasive, easiest way of doing it. And that's going to be a robotic procedure or a laparoscopic assisted total vaginal hysterectomy. So, you know, and you can also stage it potentially. You can have the DNC and say, okay, let's wait. Let's do the DNC first. Let's see what we've got. And then maybe we'll have a discussion after the DNC, and then we'll consider our surgical options in 2 weeks, right? I mean, just see what they're willing to do. I mean, I can understand wanting to do it all at once, but I also understand the wanting to have true informed consent, wanting to know what your options are. So maybe
I have the referral until July.
Okay, so you got plenty of time.
I have a lot of time to kind of talk. Go. You know, I had already done all the steps. I had an appointment to go get this done.
Yeah.
You know, and then all this other stuff happened. So,
well, I think, hun, that millions of DNCs are done a year, and I would not be worrying about that too much. Oh, my internet connection is unstable. How is that? Oh, now it's not. Okay. And
I'm just going to tell them to be gentle as possible.
Well,
please.
you want to get specific. You know, you need specifics. Okay. What are the stages? What are you going to look for? How are you going to treat what you find? And if you do go to hysterectomy to remove my uterus, what method are you going to use?
Okay.
Will I keep my cervix? Will I not? I would, you know, keeping your cervix would be fairly important.
Sure.
I don't have my cervix anymore, and that's a pretty tender spot. So
mine too. Oh my gosh.
Yeah.
That was a huge thing with my IC. Just a whole area.
Yeah. Yeah, but again, subtyping is important here, you know, and trying to figure out what your subtype is. So, well, listen, hon, you have never been more prepared to deal with whatever happens to you because you are truly one day older and one day wiser. The fact that you delayed this for a year has given you an opportunity to become even more knowledgeable, even more informed, and even more, dedicated to putting your health in the right place.
Okay.
And I want you to, do your good anxiety management, right? So I just doing my stop sign, deep breath, minimize the thought all the way to the hospital the night before. Didn't have a single panic attack during all of my procedures for that. So do you know about the stop sign, deep breath method?
No, I don't.
Okay,
But I'll
so-
look it up on.
Go,
I've been on the IC network. I've watched your videos. Today I just logged on and I'm like, I'm gonna get on that Zoom.
So watch my video. Watch my video. I see an anxiety, which goes through that. Okay.
Okay.
Okay, hon, you got this. I believe in you.
All right.
You're tough.
By July,
You're a tough cookie. You are a tough cookie.
Oh, this disease has made me a tough cookie.
Okay, but don't think of this as a disease. Think of this as injury, trauma.
Oh, that's so true.
Okay. The only people who have disease process might be Hunter's lesion patients with a viral infection, or somebody has a chronic bacterial or fungal. We're really instead looking at this more as injury or trauma to muscles, the organ, or nerves. Okay.
And that was the thing. When you really started talking about the muscles, my doctor never talked about that in 2003.
Yeah. They didn't know in 2000.
Dissension.
Yeah.
They went in, they looked, and he said, it looks like you have a mild case of IC. And I said, what's that? To me, it was not mild.
Yeah.
It felt like I couldn't even
function.
I sat on the toilet all day. It was miserable. So.
Okay.
Yeah.
All right, hon. Nice talking with you. You keep in touch. I want to see how you're doing. Okay.
Okay.
And if you need a pep talk before this happens, you know who to call. I will give you the best pep talk ever. Okay.
Okay. All right. Thank you.
You're very welcome. All right. Now, I've got Cindy, Debbie, Eric, and Jeannie. Let's go. And guys, don't take it personally, because now I've completely forgotten who came in next. So I'm going to just go to Cindy first.
Hi, Jill.
Hi, Cindy. How are you? How is life?
It's good. Crazy during this home, staying home and not seeing any humans, but I got a puppy, so I'm good.
Oh, well, what can I help you with today?
Well, you know what, Jill? My biggest issue is my behaviors. I need a behavior plan.
Okay. Okay, like what? Give me an example.
I just won't stay away from, the only thing that I have been doing during the pandemic is driving through like coffee shops.
Ah, okay.
And I still have to calf my bladder. And I'm like my worst enemy. I just need somebody to tell me to stop doing that.
Well, okay. So listen. I did not have this a year ago. The stress comes out in many different ways. And when you're under periods of stress, for me, I love cinnamon rolls. I talk about it almost every meeting. This is my cinnamon roll belly. That was when I had my hysterectomy. So when I had my DNC, I allowed myself to have one cinnamon roll. And then when I had my hysterectomy, I allowed myself to have one cinnamon roll a day for 2 weeks. That was my payoff for having something very hard. And then I stopped. But then with the fires and then with COVID, I am eating cinnamon rolls again, a lot of cinnamon rolls. And, well, I haven't had one in, let's see, I probably haven't had one in 2 weeks, but then I made gingerbread cupcakes. So, with carob chips. Okay.
So I know that I can't do anything coffee related. I just can't. It causes pain. It causes my bladder to, I keep doing it.
Well, but why don't you just find something on the menu that is not going to irritate your bladder? Man, just go for the peppermint tea. If you're going to Starbucks, get the peppermint tea, or get a medicine balm herbal tea, which is, well, except that might hurt your bladder. But, just say, listen, you're done. Like I ended up in the hospital in the ER with my heart racing. last December because I'd done so much coffee during the fires. It just, there you
Yeah.
go. And once you're in the hospital and the doctor looks at you and says, no more coffee or you're going to be here again. And I did not want to be there again. And so I haven't had any coffee since then. But I believe in reward therapy. You're working hard. You need a reward. We've got to figure out a better reward for you.
Right, right. I think it's just the loneliness and the like never seeing human beings. It's been tough, but I don't want to cath my bladder for the rest of my life.
Are
you cathing every day?
Yeah, I can go some on my own, but I'm still cathing pretty much when I wake up in the morning. My bladder just doesn't want to work.
Well, is it that your bladder doesn't want to work, or is it your pelvic floor muscles are tight and are preventing you from peeing?
Well, it's pelvic floor because I did do the therapy, but that's another thing that is a behavior thing. I have every step of the way. I have every education that I needed from my physical therapist, but do I do it? I mean, I know that I got to do it.
You know what, the homework I always give is 15 minutes a day, do something for your spirit. For 15 minutes a day, do something for your bladder or your pelvic floor. For 15 minutes a day, do something to improve your knowledge level. And for 15 minutes a day, do something to make you laugh. Because laughter, your brain will reduce pain in the presence of laughter, but it will intensify pain in the presence of anxiety. And the thing is that, where do you live? What state do you live in?
Ohio.
So you're frozen in right now, right?
I'm frozen in. I have a puppy that I enjoy walking, but I also have osteo. So if I fall on the ice,
yeah,
I can't get out and walk. But I've been trying to do more, walking programs online or hip hop or something just to get out more active.
Right.
I write. I read all the time. I write all this stuff. I took really good notes today during your Zoom meeting. Thank you very much. You got to make a schedule and stick to it, but don't bully yourself. If you miss a day because something else is going on, that's fine. But this is about engaging in new, healthier behaviors. And so like for me, I have not let myself walk into Starbucks once. And if I do, but I do have it at my grocery store. I don't order any drinks, but I will get like a hot egg sandwich or something for family, and that's fine. So I think I spent so much money. I can't even imagine how much money I've spent over the past year just doing that. That's the one thing that I feel safe enough to do. But I'm stopping. I'll get something that's bladder friendly.
Well, just get steamed. Why don't you get steamed milk? Get steamed milk with some cinnamon spice flavoring or some vanilla flavoring.
It's just, I want to still go because that's where the girls know me.
And it's,
we can't sit inside anymore, but at least the girls are like, hey, it's just a social thing.
So peppermint tea, chamomile tea, or get a hot milk drink or a cold milk drink or a cold ice drink, but just no more coffee. You're done. Or I'm going to have the new herbal coffee. And if you want, I will, when I get it, remind me, send me an email and I'll send you a sample of it. You can try it. And you can just bring that with you and hand it to them and say, would you please put this with hot water? And that wouldn't irritate your bladder at all.
Yeah, the girls are great.
Yeah.
We all know.
I know. I haven't been to my normal coffee shop in a year, So
heartbreaking.
It is. There are social structures. But you got this, you got this. We've just gone through the year from hell. We've got another 9 months where we got to be really careful. But we're going to get through this. A year from now, things are going to be better. Things are going to be better. And I love your sweatshirt. I love what you're saying to yourself. Peace and love. And here's what I want to know. What is in writing on that wall on that black wall behind you? What does that say?
It's a French saying. It's patisserie. It's basically like
French.
something you would see in a French little shop where you would buy
I love it.
macadamia and whatever those are.
A patisserie.
But that's a chalk wall, and I stenciled that on there.
I love it. I love it. So how about giving yourself a reward therapy? You know what I'd love to see you do on that chalk wall, although I'm pretty sure you don't want to write on it because it's so pretty, is let's practice a reward. Every day you don't go to a coffee place, put a little check mark down by your heater vent. And when you've got 10 check marks, give yourself a reward. When you've got 30 check marks, give yourself a reward, but not a coffee reward, something else instead.
That's a good idea.
Okay. And I
knew if I talked to you today.
I believe very strongly in reward therapy. So you've got the tool right there. And the next time you do it, next week, I want to see 7 checks there. Okay.
Okay.
You can do it.
Sounds good.
All right, hon. Nice talking with you.
Same.
See you later.
Bye.
All right. We're going to come now to Debbie. Debbie, are you there? Debbie?
Yeah, I'm here.
Hey, girl, how are you today?
Hi, how are you? Thank you for doing another Zoom meeting. You're wonderful.
Well, it's my pleasure. What can I do for you today, hon?
Last time I spoke to you, I know you speak to hundreds of thousands of women, but I told you I had the left side pain, and I went to see a neurologist, and she said I see, but that was just by talking to me, and a quick pelvic exam, and then I didn't take the medicine because I like natural roots, and then I have the heart condition, and so that's me. And then I had my GYN, and that came out clear. I had checked my fibroids. They said no change. They don't look like ovarian cancer, because I always think the worst, like I had ovarian cancer.
Mm-hmm.
And I didn't. And then I have the urgency to pee, but I have no burning, no pelvic pain. I don't understand what pelvic pain is, but I do have like a frequency of peeing and like a bloated belly, pain on the left side. And tomorrow is my orthopedic spine doctor visit. I want to ask if that's what's causing the pain on the left side, and
Good.
Find out if it's the bulging disc that's what's making me feel like my belly is bloated and painful. I know my back pain is from the bulging disc because of course I have hardware in my neck, so I know I have spine DDD and all that. So and I also have a neurologist phone video in March, I think the second week, to talk to another neurologist, because the last one I didn't really feel comfortable. She wants me to have the camera test. I did not do yet. So I'm at the point where right now I don't know if I have IC. I feel like I have something going on in my urine.
Well, so remember, we had a study released last summer that showed that 70% of the men with testicular pain had an underlying hip abnormality. So you are doing your due diligence. You are going to see an orthopedist. You have a bulging disc. Let's get them to look at that, and let's see if that could be contributing to your symptoms. And I think you said you're going to go see a neurologist. That sounds good. I think that that's worth talking to them about. And then, we want to know about estrogen atrophy and stuff like that too. So as I've said before, that when you have pain located to the left or right of center, we have to understand what structures are in that location. And so that's what you need to do tomorrow, is when you walk into the orthopedist, describe your symptoms. Number one, where is it located? What does it feel like? And does movement change it when you bend over, sit down, stand up, twist? Just say hey man, you're there. You want a workup. You're trying to figure out why you've got these weird symptoms. You know that part of it could be your bladder, but the pain on your left side or your right side is probably not your bladder. It's probably your pelvic floor or something wrong with the bony structure. So just let them do the workup. Power to you, girl. I'm proud of you for making that appointment. It'll be really interesting to see what they see, and getting an extra set of eyes is a great idea. So you do it. Go for it.
Thank you so much.
Okay.
I did feel more powerful, like when you told me to find out questions, come with questions, do research, and be prepared. And so I feel like I could ask questions that like relate to my health. And when I went to see the gynecologist, when I had the sonogram, and you told me to tell them, find out what's going on with me. What's the mystery? Why am I in pain? Why's my belly bloated? Is it my fibroid? And I said to her, I go, is it my fibroid? Do I have ovarian cancer? Do I have a reason why? And the lady was really nice, and she said that she thinks I should go to the next step. She doesn't think it's GYN related, but I feel like I have to pee all the time.
I know, but honey, if you got tight muscles, that can make you pee all the time. If you've got a bulging disc, you and I both have bulging discs, and I hurt mine again this week. And I woke up this morning with a thigh that felt like a rock and my knee hurting. And so, and so if you've got a bulging disc at between 4 and 5, and 3 and 4, which are where my 2 bulging discs are, that absolutely is going to affect your bladder and or your bowel, which is why we've got to be really careful about it, and why I'm kicking myself for bending over and picking something up yesterday. So, just let them study you. But listen, hon, I need you to walk in calm, collected, with very specific questions. Don't start talking about everything, because you're going to overwhelm them. I want you to say, I am here because I want an objective assessment of my pelvic cavity and my bones, because I have these symptoms. And don't go into history. Don't do a lot of stuff. I mean, don't do what do they call it? Word soup or whatever. We want them to focus on studying your body. And so, let him ask questions, him or her ask questions, answer those questions truthfully. But your goal here is to get them you saying, I do not understand why I have pain in this spot. Why is there pain in this location? Can you help me figure out if this is related to a muscle or a bone or a nerve? And let's see what he's got to say. Okay, good job. You got this, girl. You got this.
Thank you. Do you do anything natural for your bulging disc?
Not. It's all very new to me, and I've only had it for 2 months, and it's kind of freaking me out, because I can't. My right leg is only about 80% strength right now. So like yesterday, I went on. I had to go over and return some glasses that I ordered. And on the way back, there were some condos that were open. And I normally like doing that, but it was a 3-story condo, one of those narrow, tall ones. I walked in and I looked at that stairway and I went, oh, crap. I am having trouble walking up and down stairs right now because my right leg gives out from this. And so, did you have an MRI? I did. I had an MRI, and they said, yeah, you have a bulging disc at 4-5 and 3-4, and and one thing he said is it's scarred over, but the scar will never be as strong as the original disc, and you're going to be vulnerable from this point forward. And if you're not careful, we're going to have to do surgery. And I'm kind of at that point going, it's hard because I care for elderly parents, and I have to sweep the floor and bend over to sweep the floor. And anyway, well, we all don't. You don't need to hear about that.
Did you ever hear of the Veriflex?
Did I ever what?
Hear of the thing called the Veriflex?
No.
It's a invasive surgery where they put a little disc between the bulging disc area, and it opens up the space, and it's an in and out thing. You don't have to have like major surgery. I had major surgery on my neck because I have hardware, but I heard something about the Veriflex. It's a new technique. Look it up. It starts with a B, I think. B or Flex.
Life, the gift that just keeps on giving as we get older.
Yeah, I
It
know,
sucks,
right? Spine problems are the worst.
Yeah. All right, hon. Listen, so you let me know how you do. I've got to move on because we're running out of time.
I will.
Okay.
Thank you.
Okay, hon.
Thank you.
Talk to you later.
Bye.
Jeannie.
Thank you. Bye.
Eric, if you don't mind, Eric, I'm going to take you last time, okay? Because I know Jeannie's been waiting in here and she came in before you did. So, Jeannie, can you hear me?
Yes, hi.
Hey, girl, how are you today?
Oh, not so good. But
Uh-oh, what's going
hang in
on?
there. Well, tomorrow I'm going for a multi-channel urodynamic test,
Okay,
but they're not sure if I'm emptying my bladder all the way.
okay.
And when I squat, instead of sitting, I squat and more urine will come out. It's the weirdest thing.
Well, no, I call it milking your bladder. Sometimes what happens is we get older. I mean, it sounds like, I think you and I, how old are you?
63.
Okay, so I'm going to say we're very close to the same age. So it started for me in my 40s, and I called it milking my bladder, where I would pee and then I would stop, and then I would go, well, not done, pee again, then I'd stop. And it's like, okay, I don't know if I'm done, pee again. And then I'd stand up and I go, nope, sit back down, stand up. Okay, am I done? Nope, sit back down. Okay, now I'm done. And my gynecologist explained that is that that's just kind of an estrogen-induced weakness of the pelvic floor muscles. And the more we do that, the more we kind of train those muscles incorrectly. So I try not to do that.
Yeah.
I tend to do that most right before I go to bed. So, okay. So are you afraid of the urodynamics?
No, what else would it show though? I'm hoping to get to the bottom of this.
Well, I mean, it's just going to it's going to test the functionality of your nerves. I had a urodynamics. I mean, it's not the funnest thing in the world, but it's not terrible.
Okay.
I mean, it's 30 minutes at the most. So they're just going to put a device in your urethra. They might put a device in your rectum. They might not. I never had that in my rectum. And then they slowly fill your bladder with fluid and they just say, tell us when you need to pee. And you go, okay, 5 minutes go by or 3 minutes go by. It's like, okay, I feel something. And they're like going, okay, tell us when you first feel discomfort. Couple minutes go by or seconds or whatever. Okay, I feel that. That's not a good thing. And then they push it just a little bit more and they'll say, okay, tell us when it hurts. And you're like, okay, stop, that it's hurting now. And they usually stop, pull everything out, and you're done. And your urethra is going to be a little bit traumatized afterwards by the procedure. And it's just kind of testing your nerves and how your nerves are functioning.
Yeah, I've had a couple of cystoscostomies and stuff like that. So
Yeah,
I kind of know what to expect.
But when did you're 63 years old now. When did your symptoms start? How old were you?
3 years ago.
Okay, so then anytime something starts after you're older, the very first thing we always want to think about is what we call the genitourinary syndrome of menopause. And that is, are we dealing with a patient who has estrogen atrophy and or all the things that are associated with getting older? Because, your bladder and your urethra rely on estrogen just as much as your vulva and your vagina does. Things start to dry out. Your bladder has a nice thick coating of mucus in it. The purpose of the coating is to protect tissue, but that nice thick coating of mucus is estrogen dependent. So when you're young, you have lots of estrogen, you have lots of mucus. When you're 60, girl, you do not have much estrogen, therefore you do not have a lot of mucus. Thus your bladder is going to be more vulnerable, period. And so before your appointment tonight, make sure you Google genitourinary syndrome of menopause. Genitourinary syndrome of menopause, and look at those symptoms and see if you can relate to those symptoms, okay?
Genitourinary.
It's genito, Genito, and then urinary, all one word. So genitourinary syndrome of menopause. So look at those symptoms and see if you have any other symptoms associated with that. That will be good information to share with your doctor tomorrow.
Okay.
Okay.
And I'm still trying to figure out what subtype I am.
Well,
I have
that would be
ICE network and looked at it, but
well, but that would be bladder wall driven. Estrogen atrophy is bladder wall driven. So, I mean, if your symptoms started after you fell, then we would be looking at muscles. If you had Hunner's lesions, we would be looking potentially at viral infection or something else dysfunctional with your bladder. But, this is the very first thing we always look at in a woman of your and my age whose symptoms start suddenly is just very simple GSM, genital urinary syndrome of menopause. And the good news with that is that number one, you're not alone. We all go through this. Number two, using topical estrogen can be remarkably helpful.
which I do that. Yeah.
Okay. And so, having them also look at your skin down there and seeing if your skin is responding well to the estrogen, or maybe if it's not, maybe they might say, instead of doing it 2 times a week, we want you to do it 3 or 4 times a week. So looking at that too. Hopefully you've already had a pelvic floor assessment. We can rule some of that basic stuff out.
Yeah.
So I'm not frightened for you in any way. I mean, your symptoms are classic GSM potentially, and I think the urodynamics is interesting. I mean, it would provide useful data. Odds are it's going to be normal, just like mine was. But it's kind of a check mark you can do. You do it, and you're done.
Okay.
Okay.
Thank you.
You're welcome.
And thank you for having this. I've only found it a couple weeks ago, but it's been great to have something like this.
You're very welcome, and you look like you could be my sister. I swear we have the same color hair, don't we?
Yeah.
We do. We do. I was noticing this morning as I did my hair, I was going, God, look, I've got these great blonde streaks right here. And I looked closer. Nope. Not blonde. White.
Yeah.
So, all right, hon. Nice talking with you. Let us know how it goes, okay? And remember your urethra is going to be very irritated afterwards.
Yeah.
And so I found for me, and everybody's different. Hi, YouTube. Sorry for not looking at you guys. I found for me that the way I got through that irritation is I made sure immediately after the procedure, I drank a really big glass of water so that it arrived in my bladder at roughly the same time. And then I just bit my lip and peed it out. If you stop and start, it's like pee out, pee out, pee out. That can go on for a long time. You could do that for 20 minutes. Whereas if you, I just found for me that I didn't like doing that. If I just had a good volume in there and I just peed it out, I kind of got over the worst of that urethral stinging fairly quickly. So I don't know what your doctor would say. It would be interesting to ask your doctor what they would recommend about how to calm your urethra down afterwards. Sitting in a warm tub, a little bit of baking soda in the water, using maybe a little ice pack. Although I never did that. I liked heat more than ice. But it goes away very quickly. I mean, normally the urethral symptoms are gone within a couple of hours or a day at the most. So, okay.
Okay.
Thank you. And the equipment's better now than it was when I had it done 30 years ago. The equipment's smaller, so you might not even have the urethral irritation from it. And we'll hope that's the case. Okay.
Okay. Thank you.
Okay. Talk to you later.
Real quick. So after my procedure, should I, like, right when I get home, start drinking water just to keep, because I do have bladder. I've had training. I've trained my bladder to hold more.
Yeah.
Not a lot, but I don't want to revert. So, should I just keep on drinking as much as I do every day? As much as I can?
No, because you could potentially be giving yourself mini hydrodistensions that would stretch your bladder. I mean,
okay.
More is not necessarily better.
And if I'm on pain medication, I might not feel that.
Right.
Pain. Okay.
Right.
All right. That's all I wanted to know. Yeah.
I was never catheterized when I had a DNC.
Okay.
And I was not catheterized after my hysterectomy either, although they did They did do a very brief hydrodistension to make sure they didn't puncture my bladder, but I had no,
Okay.
I had
didn't
no
know that.
problems with it at all.
Okay.
Yeah.
So maybe I can request no catheter.
And if
I mean,
for a DNC, I can't imagine why they would do it because it's so
I don't
fast.
see. I don't know. I just figured when you go get stuff done like that, they put you under. They're going to give you a catheter.
No. They don't automatically do that, and that's a really good question for your pre-op appointment. And you can say, "Listen, man, please do not mess with my urethra too much."
Okay.
Yeah. Okay.
Okay.
Okay, hon.
Thank you for your answer.
You're welcome. All right, Mr. Eric.
Howdy.
Hey, dude. How are you doing today?
Well, if you'd asked me Wednesday night, for the first time in I think the last 4 weeks, I felt like what I considered to be normal, and I couldn't sleep like for several hours because I was just sort of like, oh wow, this is what it feels like to feel good again. But then subsequent days, and particularly yesterday and today, the symptoms have kind of amped up again. And I was like, darn it. That's not really what I want to say.
Well, yeah, but highs and lows, nerves get irritated, nerves calm down, nerves get irritated, nerves calm down, stress levels go up, stress levels go down. We would love for it to be a steady incline like this, but it's never going to be a steady incline. It's always going to be a reflection of what's happening in your daily life. And especially in your case, as we're trying to calm nerves down and calm stress levels down and calm anxiety levels down, if I were to bet, your anxiety level probably been up the last 2 days as you noticed your symptoms amping up. Were they?
Yeah, because I get real anxious about having to go on car trips right now. I normally don't, but just because of how I'm going to be feeling. And so last night we had a dinner up in Minneapolis, which is about an hour away from where we live. And I was like, I was like, I don't know that I want to do this. And of course, everything was kind of out of whack again.
Okay, but did you do it? Anxiety. But you drove to Minneapolis, did you? Or
I said to my mom, I said, you know what? I'm just going to do this and screw it. And if I feel uncomfortable. And then while I was there and distracted, engaged in conversation, my bladder, I could tell I could have to pee, but I just kind of ignored it and engaged in the conversation and forced myself to do it and said, all right, fine, I'm just going to do this, discomfort be damned,
So, okay. So, number one, I'm so freaking proud of you for doing that. I think that's good job. Good job. And understand that it was a stress of thinking about that car trip. I mean, seriously, if you tell me I've got to take a plane flight tonight, I will have an IBS and IC flare. I will, absolutely. It happens every single time. Why? And I think that you and I and so many of us have we all have our own issues. We all have our own issues. And one of your buttons and my buttons is about restroom access.
Mm-hmm.
And another button for me is about driving for a long period of time because the bouncing will cause my pelvic floor muscles to spasm. And so, but the reality is that it's important that we expand our horizons slowly. I can remember there was a time where driving into town 2 miles felt like 100 miles for me. And it took, the pain everything was so messed up. That was really hard. And God forbid it be a Dodge Dynasty, which is what I was driving in. Oh, look, my dad is coming in. Oh, look, YouTube, you can see my dad. Wait, Dad. Come on, Dad. You have to come over and over on this side so the people on Facebook can see you. Here. That's my dad. He's Jack. He's Jack. I'm Jill. Yes, I grew up as a Jack and a Jill. My brother is Jack also.
Hi. We're all alive.
Aw,
Yeah.
sweet.
And well, 98.
98 years old.
Wow.
Wow, that's awesome. 98.
He's kicking, that's
Yeah.
for sure.
He's still singing and dancing.
Yeah.
Awesome. There you go.
All right.
I tell you, boys, it's tough to be alone, but it's tough
You're
to have
telling me. You're singing to the choir.
All right. Okay. So, Eric, thank you, Dad. Getting back to this. So you had a completely normal, natural response to doing something that you knew would have the potential to irritate you. And that's when you do your stop sign, deep breath, minimize the thought. I'm not God. I can't predict the future. For all I know, this trip is going to be great. I'm going to have a fantastic time, and we're going to get home, and life is good, and I'm going to be so happy that I win. But the reality is, it's hard work for you and I to do that. It is work, and it is. There is history there that our brain remembers. You know, we can't ever forget that something's happened. They happened, and our brain is always trying to protect us. And so there's part of your brain is like going, are you sure you want to do this? Are you sure you want to do this? It's like, yeah, I'm ready to try. I'm going to increase and expand my horizons every month and try something different. And the fact that you did an hour was great. You did an hour was great. Now reward yourself, not with soda. Reward yourself with a good steak or whatever. And you know, practice more trips, but do 20 minutes, 30 minutes, 40 minutes. Just get out and drive around a little bit when you can, okay?
Yeah, I think the hardest thing to accept is, you know, I know, you know, I still want someone to say, this is why your nerves have gotten excited, or these particular nerves, and this is why after a bowel movement, you're going to feel, your bladder is going to feel more sensitive right now. You know, I want that. I want to demand it from a doctor and say, no, you can't say that you don't know. Then you find someone who can, is what I want.
Well, listen, no doctor can tell you when you need to pee. No doctor can tell you when you need to have a bowel movement. You're the only one living in that body, and you're the only one who knows your truth. And like for me, basically saying my skin is sensitive. If I tell a doctor I've got to wear my pajamas inside out because it seems to annoy me, they're going to, you know, some of them are going to be like, well, that's excessive. And it's like, no, I have a sore rectum. It is what it is. I got to do what I can do so it doesn't get triggered. So, you know, don't keep looking to other people, dude. This is your body.
Yeah.
And you're wise. You're wise to your body. You have to learn what makes your body thrive, learn what makes your body not thrive, and stress it out, and then kind of push the envelope a little bit, and let's try to get some joy and happiness back into all of our lives again, right? And for anybody who's wondering, this is my shipment of KY. I have no shame. I'll talk about anything. Okay. All right. So good job. Calm it down. Work with the anxiety. Do your deep breathing. And be proud of yourself. Make a note in your diary. You did it. You proved that you can do it, and you will do it again.
Yeah.
Okay?
Yeah.
Okay. You're looking good.
Thank you.
I think you're looking good. All right, keep it up. Any other questions?
No, I think that was it. I just wanted to make it kind of short and sweet today.
Okay. All right. Thank you for waiting. I appreciate it.
Not a problem.
All right. Okay, Zoom. we are done. I believe that we have hit everybody. And so I am going to now thank you for coming into Zoom. It was great seeing you guys.
Thank you. Have a good night.
You will all
Thank you.
see us next week. I want to hear back from some of you about how you did this week with your appointments. And let's keep in touch, okay?
So you do this every Sunday?
I try to do it every Sunday.
Okay.
I'm on a string right now, but once it's fire season and other things like that, then I sometimes I can't do it. So yeah. All righty.
I don't know if Eric is still there, but I've never met a man with interstitial cystitis. That's just such a long word. But I admire that he's on here.
Oh yeah. Yeah.
And once I saw there was a man on here, I'm like, I felt my heart sank.
You know,
there's obviously a lot more of us ladies.
But there's not. There's 48. The last study was 48 million women, 1 to 4 million men.
Yeah.
And
I think maybe men don't go in though, or get diagnosed correctly.
You're right. We now believe that the great majority of men have been misdiagnosed with prostate issues when in fact they do have pelvic floor, bony structure, bladder, whatever. So, and they're very quiet. They come, they watch, they call me, but many of them don't participate. But I've worked with thousands of men over the years. And that's kind of my specialty actually, is working with men. So
I admired that he was here today.
That's awesome. Thank you. Okay. All right, Zoom.
Okay.
See you guys later.
Bye.
Bye. Thank you.
All right. We're back to Facebook and we're back to YouTube. YouTube. So you guys, we're simulcasting on Facebook and YouTube, and I'm testing a new arrangement. When I'm looking here, I'm looking at Facebook. When I'm looking at here, I'm looking at YouTube. And I apologize for the confusion, but I'm just doing some testing with computer connections. So I'm coming back to your questions now. Let's see. So Ashley was asking about pins and feeling of needles during your period, trying to come out of your bladder. And the answer is no, that's absolutely not consistent with IC. That really, to me, tells me that you're probably having really, really, really strong pelvic floor spasms that are squeezing a nerve. Pins and needles tells me that nerves are involved in some way. So I would definitely talk to your doctor about that. That's interesting. Diana says, one good substitute that I'm using for almost a year is Ticino chicory herbal coffee. You know, girl, I'm glad you like it. I couldn't get into Ticino. I thought it was very bitter. Very bitter. It was Ticino as the herbal coffee was my least favorite, to be quite honest. But girl, if you like it, go for it. And then we have another person who says, do you believe that a macrobiotic diet can cure IC? Well, number one, you don't cure it. You don't cure an injury. You heal an injury. Right? We have subtypes. So let's go through those subtypes again. So subtype 1, Hunter's lesions. Could a macrobiotic diet cure a viral infection? And the answer is, I don't know. I don't think so. Bladder subtype 2, let's talk about chemical injury. Let's say this is the patient who's developed symptoms because they've gone through chemotherapy or they've used ketamine or they drink too much diet soda. Would a microbiotic diet help them? Yeah, if it would get them off the damn sodas and coffees, it could. Would a macrobiotic diet cure pelvic floor issues? IC subtype 3, pelvic floor dysfunction? No, but it would certainly create good nutrition for good, healthy muscle tone. So I would support that. Pudendal neuralgia? No. Central sensitization? Potentially, because people who have central sensitization, like myself, and chronic sensitivity, we do have a lot of weird food sensitivities, especially to artificial stuff. And so, but I really disagree with the word cure. You don't cure an an injury. You heal an injury. And the assumption that I see as an incurable disease of the bladder is incorrect. Because for many of you, it's not. For many of you, it is injury to the bladder. Genitourinary syndrome is not a disease process. It's estrogen atrophy. You don't cure it, you treat it. We're never going to get that bladder back to an 18-year-old bladder in a 60-year-old. So we're going to give the bladder what we can to promote as much healing and physical protection as we can. So I hope that kind of makes sense. I hope that makes sense, kind of, sort of. You guys on YouTube, you can see my project board back there. As you can see, I'm very driven by Post-its. I have Post-its everywhere. I have Post-its all over my computers, and they're all different colors because I'm a color girl. My brain likes colors when I work. Go figure. Okay, hold on a sec. That's somebody from Toronto, Canada. I'm not answering the phone right now. If you're calling, I'm still doing my live stream. All right, now on Facebook, did I miss any questions? How are we doing on Facebook here? I don't even know how many people are in here. It will not show me. Sandy says, I feel this is in my genes. All my children suffering from symptoms too. Well, again, I explained that earlier. You know, sensitivity can be passed on for sure. Sandy says, I don't think I see trauma anymore. It's been 20 years and I'm feeling this is in my genes. Well, central sensitization can be inherited. It's a gift of our ancestors. We can't change it. We got to respect it. Got to respect it and nurture the unique bodies that we have been given. Not everybody's born to be a orthopedic surgeon or a trial attorney. Some of us are born to be writers and poets and support group leaders. Finding that environment where you thrive is critical. It's critical. Not everybody's meant to live in a city. We're not comfortable. We do better in the country. I wish somebody had said that to me in my 20s as I was agonizing over what I was supposed to do. I mean, I knew I wasn't going to do animal research. I love animals. And I was really in a dark place because I just didn't understand my purpose in life. And I didn't understand all these sensitivities. And I just didn't understand. And I wish somebody could have gone back in time with me and said, finding a career isn't just about what stimulates you intellectually. It's about where you thrive physically. Where is your body happy? And my body was not happy in a big city, in a big office with a lot of people talking to each other. It's too much noise, sound, stress. I do better in an environment that I can control without a lot of stimulation. So, all right, guys. Well, I think that's it. I wish you well. Y'all have a wonderful week, and I will see you again next week. I am I may do drop-in meeting. I may be splitting YouTube and Facebook into different days because I need to clean up your streams and do better recordings because our recordings have sucked. With respect to stream quality. And I need to start filming more videos. So I'm going to be doing that. All right, guys, I will see you later. Y'all have a good week. Come on over to our website, sign up for our free newsletter at a minimum. If you really like this, please become a member so you can get our wonderful magazine, which I truly believe is helpful and will empower you and help you be a better advocate for your care. All right? Okay, see you later. Bye-bye, YouTube. I'm going to turn YouTube off first. Bye, YouTube.